Good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick, joined by my vice chair, Bonnie Collison, who is going to be giving testimony pretty soon on House Bill 430. We're going to go through some very quick rules here to make our life easier. I kindly ask that if we encounter any technical or streaming issues to be patient. Please turn your devices to vibrate, and I'm doing that myself. As a reminder, there's no food or drink in the gallery. For us, we get to drink because we're here for hours. For each bill, we're going to hear from the bill sponsor and the sponsor panel, followed by an all in-person witnesses, and then we're going to do virtual. We have favorable with amendment, and unfavorable. When I'm able to, I will alternate between favorable and unfavorable to give everyone a fair chance of being heard. In this committee, I have made the decision of not timing the bill sponsor testimony. However, please be considerate. While all the other witnesses will have 2 minutes to provide your testimony. A timer is displayed on the screen and at the witness panel, and a sound will play when your time has expired. For our committee, thank you so much for all the hard work. Thank you for being here, even though we have very bad weather. I really appreciate it. Please adhere to our usual committee rules of 1 question, sometimes, 2, but remember that the bills go to subcommittee and that you also can contact the witnesses and ask questions, offline. Members of the public will be able to view this live stream on the Maryland General Assembly website and on YouTube. Today we will hear the bills, and I'm not even going to tell you the order yet because there's some people that are missing. So I'm just going to go with who I see, and that is unusual. But we need to be a little flexible today. We're going to start with Delegate Collison, House Bill 430, Employee Individuals with Disability Program Upper Age Limit Prohibition. Vice Chair Collison, good afternoon.
Good afternoon, Madam Chair, members of the committee. If Gregory Snyder is here, if he would come up and join me. I'm not sure. Thank you, Gregory. Thank you for the opportunity to present this bill to you today. You heard a bill about the Employed Individuals with Disabilities program last year. You met some folks in that program. As I recall, you were incredibly impressed by these individuals who are significantly challenged physically in order to achieve their, even just the activities of daily life. But yet they were determined to continue working and be contributing members to our society. We were not able to move the bill last year. It has a huge fiscal note, as you might imagine. And so we were asked to meet with the health department during the intersession to see if we could come up with some programs that might help. And I was very grateful for the opportunity to meet with advocates and representatives of the health department over the summer to talk through these issues. So I want to remind you what the Employed Individuals with Disabilities Act is and how it works. It is actually a Medicaid buy-in program, and it's not unique. It exists in most other states, and it is for people who are currently working but would not be eligible for Medicaid due to income, but they can't make more than $75,000 a year. The program covers medical services for those who don't have other insurance, or it can supplement services that a private insurer doesn't cover. Those who have Medicare are part of their Social Security supplement security income can save them as much as $12,000 a year in premiums by being part of the EID. The current criteria to be included is you have to be between the ages of 16 and 65, you have to be working and paying taxes in Maryland, you have to have a disability that meets the Social Security medical criteria, you have to be you have to live in Maryland, and you have to have less than $10,000 in assets, resources in hand. So that's who these folks are. It is an incredible resource to these residents, and they depend on the services they receive for just being able to go through their day, making sure that they have food, that they can take care of hygiene, all of the things that we just take for granted every day. And on this program, they are thriving. They are participating. But last year when we came to you, we asked for two things. We asked that the age cap of 65 be eliminated, and we asked that spousal income, so that the spousal income would not be counted against them to continue the program. In our meetings with the health department over the summer, we were not able to come to any kind of agreement around cost sharing when there is a spousal income. So that's something that will need to continue to be discussed. So the bill before you today is simply eliminating that 65 years of age cap. I will admit to you all, I am way past the age of 65, and I think I'm still working. Thank you, Madam Chair. And it is the ability for me to work at this age that keeps me physically, mentally, and engaged in my community. And I want these folks to have the same advantage. So in our meetings with MDH, we looked at the program in other states. And MDH modeled what they thought the cost would be if they were to take the age cap off, based on the experience in Connecticut and New Jersey, which we thought were most like us. So they came up with a number. It's a little bit different in the fiscal note, although we're still in the ballpark, that it would cost the state, well, first of all, that they estimate that 400 residents, if they all took advantage of it in FY26, would be eligible with that beyond 65 if we pass this bill. And that it would cost, if every single one of them took advantage of it, somewhere between $1 and $1.3 million to the state, and then, with a federal match. It's a 50-50 match. Given our current fiscal situation, that number is hard to justify. And we know that. But we want to make sure that people remember this group of people, and we can keep them in mind as we think about our fiscal situation. And I want you to think about long-term impact for a second, because I have to tell you, I was pretty astounded when I started thinking about this. If all 400 individuals were forced to pay out of pocket for the services they're currently getting through this Medicaid buy-in program, it won't take them long to completely spend down all of their money and all of their resources, and they will have to discontinue working because they will not be able to go to work, whether it's remote or whether it's, in a location. I did some rough back-of-the-envelope calculations. I based my calculations on an average cost of a residential service provider, around $23 an hour. And I was very conservative and said, well, what if they only need an aide for 8 hours a day? So if you think about a person who needs an aide 8 hours a day, 7 days a week, there are no weekends from daily living. So times 7 times 52, that's $66,000. If they're making less than $75,000, doesn't leave much for rent, food, medical care. So, therein lies the problem. They are going to end up in nursing homes where the state is paying for them. So then I did the calculation on, and I'm being very generous, to say the cost of a nursing home for an individual is about $100,000 a year, already more than the $66,000, right? If all 400 of them end up in a nursing home, and I had to do this calculation twice. I think I checked it out 3 times on the computer, on the calculator. $40 million. Maryland is, total. Maryland is going to pay $20 million for these folks in the next 2 years. I'd suggest to you, knowing, again, understanding the fiscal constraints that we have this year, that if we had been thinking of this long term, we could have been saving a lot of that $20 million. We really need to keep that in perspective when we're talking about these folks. I really think that it's in the state's best interest to continue to provide the services that are not included in Medicare. And you're going to hear from Janice today, whom you heard from yesterday, who has been cut off from the program and the impact that it's had on her, because I think she would be okay with me saying she turns 65 in December. I expect to continue these conversations over the intercession again, hopefully to look for options to resolve what should be an equitable program for Medicaid recipients. And I'm really grateful that MDH is actually recognizing the problem and willing to work on it. So once again, I'm asking for your support for some of the most vulnerable residents. Listen to their stories again if you haven't, and for some of you, newly. You will listen with an open mind and an open heart, and honor the courage, resilience, and determination that these folks have to be full participants in our communities. And I humbly ask for a favorable report of this bill. Okay.
Thank you so much, Vice Chair Collison. Good afternoon, Chair Pena-Melnick, Vice Chair Collison, and esteemed members of the Health, Government, and Operations Committee. My name is Greg Snyder, and I'm the Vice President of Government Relations at the Maryland Association of Community Services. I'm testifying today on behalf of the Maryland Developmental Disabilities Coalition to express our strong support for HB 430, which seeks to prohibit the establishment of an upper age limit on eligibility for the Employed Individuals with Disabilities Program. First, I want to thank the committee for your leadership and steps you've taken over the years to broaden the EID program. Your efforts have really made a significant impact in the lives of many people with disabilities across Maryland. I would like to share a real-life example of how this legislation could benefit someone in our community. There's a gentleman in Baltimore who's received supports from a community provider and has worked most of his entire life. He earned retirement income and is now over the age of 65. However, his retirement income is just $7 a month over the income limit to qualify for the waiver. Because he's over the age of 65, there's currently no mechanism to address that small overage. It's important to note that he is currently state-only funded due to that overage. If he were able to be included in the waiver program, as this bill would allow, and as he was before he retired, it would ultimately save the state money while ensuring that he receives the support he needs to thrive. Furthermore, this legislation promotes the concept of real jobs with real wages. By eliminating income and asset limits, people can advance in their careers, receive pay raises, and save for their futures, all while retaining the vital services they need to thrive in their communities. In conclusion, HB 430 is a significant step toward fostering an inclusive workforce and ensuring that people with disabilities can lead fulfilling, productive lives. On behalf of the Disability Coalition, I respectfully ask for your support in passing this important legislation. Thank you so much for your time and consideration.
Thank you for being here. I'm going to open it up for questions now from
Before
this
the
panel first.
Virtual, okay.
Are there any questions? Delegate Johnson.
Thank you, Madam Chair, and thank you, Delegate, for this bill. Now, by allowing them to continue working, aren't they actually helping pay into the program that getting the services from?
Go ahead.
Yes, exactly. So if he, first of all, if he were able to still be in the waiver, not only would he just get state funds, but we get matching federal dollars. That would be some cost savings for the state. But your point is exactly correct that he would be able to.
Follow-up, Madam Chair? And is by calculating income, when they calculate combined income, is that in any way impeding individuals with disabilities out of fear of losing their assistance from getting married?
Absolutely. There's federally and across the board, there are things in place that make it hard for people with disabilities to either have jobs long-term or make more money because there are asset limits for certain programs in order to receive services.
Thank you, Madam Chair.
Bring the virtual witnesses up, please, while we continue the questions. Any other questions? Yes, Delegate Kaiser.
Thank you, Madam Chair. Delegate Collison, I do remember this bill from last year, and I think the visit that many of us.
Bring the virtual witnesses up, please.
Oh,
Can you please, Ms. Jackson, please mute yourself? Thank you very much.
and, well, the timing works out well because the two individuals on the screen are the ones that met with many of us in our offices last year and also came to the hearing, and super compelling issue, one that really stuck with me. I wasn't sure what, if anything, we successfully did last year on this, or how you've changed it from last year. So I'm sorry if I missed that in your original testimony.
We have not changed anything. We met with the health department. They are continuing to say it costs too much money. And they did, like I said, they did some modeling based on other states. And, again, that state number is somewhere, I think the fiscal note is like 27 million, not 27 million, 2.7 million. And that's half of that is the state. So I don't have the exact figure in that. But I will tell you that it was not the weather that kept these two folks from visiting us today. It cost them $600 last year for them to come here, to be transported here. So it was financially prohibitive for them to come back this year.
If I could ask a follow-up? Thank you, Madam Chair. When you said that when you reported that the department did modeling, obviously our fiscal notes only include the direct costs and not the indirect costs and benefits.
Correct.
So what is it in their modeling? Because presumably in their modeling, they would be free to do all that analysis. So what do you know from their modeling of this?
Well, the reason they use the other states is because they had to have a notion of how many people would actually take advantage of it. And so that's what they base their cost on, the percentage of people. And it turns out that in Connecticut and New Jersey, a lot of people take advantage of it, and they continue. So that was what they were using that number for.
Thank you.
Thank you. Any other questions for this panel? Delegate Bagnell.
Madam Chair, and this message, this question is from Mr. Snyder. These places of employment, they don't have a mandatory retirement age on the employment, is that correct?
That is correct. So the issue is that the gentleman in Baltimore, for example, was $7.42 over the retirement income. Obviously, he was at the age of 65, wanted to retire, enjoy his life, do things that he wants to do in the community. But because that retirement income makes him $7 a month over the asset limit, he fell out of the waiver and is now state-only funded.
And if I could have a follow-up?
Sure.
So that also means that the employers would benefit if they were to be able to continue with their employment,
Absolutely.
is that correct?
Correct.
Thank you. Thank you very much, Madam Chair.
You're welcome. All right. Delegate Bandari?
Yeah, thank you. Madam Chair, this question is to Snyder. I'm reading the Bipartisan Policy Center. They also support this bill, removing age limits in Medicaid buy-in programs. How does this bill align with their finding that, the projection that support the expectation that this policy will change and bring more increased workforce participation and reduce dependency on other state-funded programs. In the long run, actually, it is good for the state. So do you have any thoughts on that?
That is our understanding as well, that ultimately, if this bill were to pass, it would end up saving the state money. State-only funded costs the state more, obviously, because when they're in the waiver, you're able to get matching federal funds. So if this bill were to pass and people were able to participate in the workforce beyond the age of 65 and still receive the services they need, it would ultimately, long-term, save the state money.
Thank you.
Thank you.
Am I allowed to chime in as well?
No, we're going to be calling on you in a minute, okay? Hold on a second. Delegate Hill.
Thank you, Madam Chair, and thank you, Madam Vice Chair, for the bill. It's, it's another one of those benefits cliff where we help people and then we kick them off. I think the age 65 must have been, some genius thought that you then qualify, or 65 you qualify for Medicare. So why, for many of these people, is it not a good alternative to keep working to buy your supplemental insurance and let your supplemental insurance pay for the benefits you were getting from Medicaid? Why is it better for many of these people to be dual enrollees of Medicare and Medicaid rather than be Medicare plus a supplemental and keep working to pay for their supplemental?
Do you want to answer?
I mean, I think for us and for people with disabilities, it's just about choice, to be able to have the option to be able to still have employment and receive the necessary waiver services that they've had throughout their employment term. A lot of folks, in order to get to their jobs or to fully do their jobs, need that support staff to be able to be successful in their roles. So I think mostly for us, it's about the choice of the matter.
All right, let me go to Joshua. How are you? You can go ahead and unmute yourself.
Good. Thank you so much. And to
And I know-
answer that question, it
Delegate
really-
North, one second. I was trying to rush things along, so I apologize. It's okay. All right, go ahead.
to best answer that question, with
Yes.
Medicaid versus Medicare, Medicare will not pay for long-term care supports like caregiving. So the only place for somebody like Janice or myself to turn for caregiving supports and nursing services, attendant services, is Medicaid. So once we get at 65, get kicked out of Medicaid and go into Medicare, we lose all of those caregiving services.
Thank you. You want to go ahead and give us your testimony? I was intentional, so you could hear the questions and then try to, incorporate it into your testimony.
Janice, do you want to go first or do you want me to go first?
You can go first.
So I'm here. My name is Josh Basil. I'm a C4-5 quadriplegic. When I was 18 years old, I was at the beach. A wave picked me up and dropped me on my head. That day I heard a loud crack, and I've been a power wheelchair user, paralyzed below my shoulders ever since. I did return home, went to community college, undergrad, graduated magna cum laude from law school, and joined the workforce. And the only way that I was able to do that was because of the Medicaid buy-in program, EID, Employed Individuals with Disabilities. This program has given me the ability to stay in the community, not only to survive in the community, but to thrive, because work gives me dollars towards my quality of life, gives me also the ability to start a family. But at the same time, it's one of those things that I know at some point I'm going to turn 65 and all that's going to come to an end. And for someone like Janice, who has been one of the biggest champions of the disability community in Maryland, she's dedicated her life, sat on every committee, commission, you name it. Janice has dedicated her life to the disability community. And she turned 65 in December. And even before 65, she was kicked out. Right before that, she was kicked out of Medicaid. In the last 3 months, she's been surviving on her own, thanks to friends and family. But it's going to catch up to the point where the only place she's going to be able to turn for caregiving is a nursing home. Being able to have Janice work, pay taxes, pay an EID premium. The more you make, the more you pay into the EID system. The ability to be able to do great work and to change lives. And working gives us so much more than just and a paycheck. It gives us purpose. And to be able to have that pulled away from us means that 65 and over, it's like my life of being able to work and contribute is being pulled away from me. And Janice deserves better. We all deserve better in Maryland. And this is a bill that would absolutely give more to the state than taking. Because at the end of the day, if you're not getting these services, you're going to have to quit and then get into the system and cost the system even more money. So it's might as well allow someone to continue to work, to just continue their benefits and be productive citizens in Maryland. Thank you.
And thank you,
Ask me to
Joshua, for,
find in favor of
thank you for your testimony.
thank you.
Joshua, every time you come here, and I have known you now for many, many years, it is always very impactful to hear your story, and I want to thank you on behalf of the committee for sharing it, and I'm so glad you're with us. And I want to thank you for your passion as well, okay?
Thank you so much. And I know we want this to go through. It's just, we got to find it. And we've been asking for this for 5 years now. We've been meeting with, I first met with Governor Hogan, and he said, we need to do something around this. And we've been meeting with the Department of Health for 5 years, and they keep wanting to kick the can on this issue and kick the can. And what happens is people fall through the cracks. And Janice has fallen through the crack. And I love her so much, and I don't want this to happen to her or anyone else going forward. So we've got to find a way to change this sooner than later.
Well, thank you very much. And you can feel the love you have for her. So Janice, you know that you are very loved and respected here. You can, thank you for being with us. We really appreciate you and for everything you do. Can you please give us your testimony?
Yes, good afternoon.
Good
Madam
afternoon.
Chair, Delegate Colson, and member of the committee. I just want to thank you for listening to me once again concerning House Bill 430, which I am in favor of. And it was mentioned that I did turn 65 on December 7th. And while that was devastating and I knew it was coming, I didn't know the impact that it would actually have on my life. And I think what was more hurting is the way I was treated from the state. I was taken off of the program before I turned 65 with no notification. And to this day, I have not gotten a letter, text, email, or anything telling me that I was not qualified anymore for the program. But what I did receive was a certified letter telling me that I was not a priority on the only program that I qualified for, which was the community option waiver, and that I would be placed on the list. And this list is thousands and thousands of people waiting. And ironically, most of them are waiting to get out of a nursing home back into the community. I'm just trying to stay out of a nursing home and stay in the community. So it just felt like I was just guarded after I was no longer qualified. But these last 3 months have really been life-changing. And that's why I really wanted to come here today, not for me, but for all those who will come after me, who turn 65, and who relied on this program so heavily, that I just want you guys to realize how important this is. And the stress that came along with me not being on this program has been so
It's okay,
hard.
you can continue.
It has been so hard, you know, going from a successful woman, a successful, productive woman in the community, to not knowing day to day if I'm going to even get out of bed to have someone help me. It's been life-changing. And, you know, we have to pass this. Like Josh said, it affects so much in one's life. And, you know, I'm here today just pleading, you know, for the committee and the governor to really take a look at this program, because there are many that's going to come behind me that is going to be 65. And I think one of the committee members said it's like being kicked off a cliff. It's like being kicked off a cliff, and for the first time I feel handicapped. I've been a strong woman for so long, but this really deflated me as to what is the next day going to hold, just because I'm penalized for aging, and it's devastating. So pleading for this bill to pass, and that we have the opportunity to retire when we want to continue to work as long as we can. So I thank you guys for listening, and and realizing how important this program is. Thank you.
Thank you, Janice. And again, on behalf of the committee, I want to express our gratitude for you for being here. And we're really sorry for what you have experiencing and are experiencing. So just want to let you know that, okay? And we will do our best. But you have a lot of fans here and people that love you. Thank you so much, okay? Are there any questions for
Yes,
these
thank
two
you.
witnesses? You're welcome, Janice. Any questions? Seeing none. Thank you both for making time. I know that it's not easy, and I want you to know that we appreciate you, okay? I hope you have a blessed evening and stay warm.
Thank
This
you.
actually,
Yes,
you're
thank you.
welcome. You're welcome. This actually concludes this bill hearing on House Bill 430. We do have members of the Ways and Means Committee, so we're going to go on to that bill because we were trying to find people, and my staff have been calling everyone's offices in committee. So we're going to go with them, and then I know we have two other delegates waiting. We're going to get to you, okay? I promise. So I am going to call now the bill is Delegate Collison, is House Bill 672. And I believe that's the bill you're here for. And can you tell us, please introduce yourself? We have two members. Yes,
Delegate Greg Williams.
come up and have a seat right here.
Bob. Delegate Bob.
All right. And we had a third delegate. Would you like to?
Mary Q. North, and she had to go to another hearing.
All right, you can join us here, please. Yeah, my pleasure. Delegate Collison, will you bring your panel, please? And when I open it up for questions.
Well, either my panel is
Go ask
all
questions,
virtual
okay?
or they are not here.
Okay,
So I will go ahead and get started.
thank you.
Thank you, Madam Chair. Thank you, members of the committee. Again, I didn't know I got a few extra steps in. I appreciate that.
It's okay.
Thank you for the opportunity to present House Bill 672 to you today. This is a continuation of my focus on making sure that we're taking care of our students in our public schools. Between the ages of now 4 and 18, most children in our state are spending 6 hours a day, 180 days a year in our public schools. Now, we know the mission of schools is really to facilitate learning. But we also know that there are a lot of factors that impair learning and are barriers to learning. And these are things like, we want to make sure that we know that students learn best when they're fed, when they feel safe and secure, when they get enough sleep, and when they're physically healthy. And those are just a few of the factors. There's not much we can do about most of those factors, but there is something that we can do about some of the the health programs that we have in schools that can mitigate some of those issues. And that's what this legislation seeks to do. It actually builds on the work of the Commission to Study the Healthcare Workforce Crisis. So the combination of, looking at the workforce crisis in a holistic way, but also how it affects schools. And in 2022, the commission undertook a 2-year study to frame the recommendations for ongoing efforts to address the healthcare shortages. Here's one of the recommendations, and with your indulgence, I'll read it. It says, healthcare workforce data should be collected, analyzed, and managed within a state data system on a consistent basis. Healthcare workforce trends are fluid, a point that was reinforced by the COVID-19 pandemic. One-time collection efforts only provide a point-in-time snapshot of the current landscape and the predicted need. So we know, that's the end of their quote, we know that the healthcare professionals are constant, sometimes severe, in our school and wellness programs. The shortages have a profound impact on the health and well-being of students in our elementary and secondary schools. We're undertaking, as a state, a number of initiatives. In 23 and 24, we expanded this, our Appropriations Committee expanded the Janet Hoffman Loan Repayment Program to include school nurses and school-based behavioral health professionals, including counselors and school social workers. The Medicaid program has launched an initiative to expand Medicaid reimbursement to school-based health center services. The first phase of that program expands billing for social workers and school psychologists. Future phases are going to include occupational therapists, speech language pathologists, physical therapists, school nurses, and dental hygienists. And then there's the blueprint. And the blueprint has invested state and local resources into increasing access to primary behavioral health and dental services in our schools. The state agencies and the community stakeholders are engaging in these initiatives that I just described without a consistent source of data. So you're flying blind. You're not getting the information you need to be able to make informed policy decisions. So some of the data might be available at the local district, but there's no source for statewide data. The latest available data for school nurses was 2018 and 2019. So this legislation seeks to address that gap, that data gap, by requiring, and you all know that I'm a big fan of collaboration and agencies working together. So requiring the Maryland Department of Health and the Maryland Department of Education to work together to regularly assess the number of school health and wellness practitioners. And in the bill, you'll see that we define all of the different wellness professionals beyond just a school nurse, and that's very deliberate because each one of those professionals contributes to mitigating the barriers to learning that students who are affected by health issues have in their schools. The agencies would also gather data from stakeholder groups, including the professional organizations. We did a sponsor amendment that says this data should be public information, and it should be on the websites of the health department and the education department. This will make the data easily accessible, and it will help policy analysts who engage in studying healthcare professional shortages. I am willing to work with amendments. There are a couple of amendments. I am concerned about the amendment from the health department, which eliminates all the recognition of all the auxiliary services in the bill. So that's your speech pathologist, physical therapist, all of those folks. I'd like to continue to include them, but we can have that discussion. I'd like for you to be aware that the Montgomery County Health Officer was going to come today, but unfortunately he could not get out of another meeting. And so the Health Department has sent a letter, it's under Leslie Frey's name, but it is from the county, from Montgomery County, expressing support for this bill. And I am hoping that you will see the value of this legislation. This one should be free and should be fairly easy to do because this data exists, it's just never gathered in any meaningful way in a school system. And I'm going to remind you that I worked in a school system for 32 years. So I know how many times they were counting speech pathologists and how many times they were counting counselors. But again, the data is not available. I want to thank you for your consideration of the legislation. It will really solidify our support for student learning and thriving, which by assuring that we can address the health issues that affect them. So I humbly request a favorable report on this bill. Thank you. I'll turn it over to Robin.
So, thank you, Robin Elliott. I want to thank the committee also for my extra workout in running from the Senate. I'm very appreciative of the tunnels today. That's right. I was like, maybe I might need a school nurse, but I think they're virtual. So here today on behalf of the Maryland Association of School Nurses, school-based health centers, social workers, occupational therapists, you've got a really robust sign-on letter in your packet. Here to just underscore what our wonderful sponsor just relayed. I've been working in school health maybe not quite as long as the sponsor, but close. And one of the things that I've realized is I've been using data for school nurses that is from 2018 and 2019. I first got that data when doing some work with Delegate Valentino Smith. So it has been a while. That data is attached to my testimony also doesn't include school counselors, school psychologists, speech pathologists, and really to think about school health, we need to think about the entire team. They do not work in isolation. So really would appreciate support for this bill completely, as the sponsor said, recognize maybe every year isn't quite achievable for the department, especially at this time, but just even starting somewhere would be tremendously valuable. And this is essentially an extension of this committee's work and the bill that you passed a couple years ago on tracking healthcare shortages. That was then Delegate Ariana Kelly and Chair Beidel. So thank you so much.
The Attorney General again. We're going to have to start charging you a fee in HGO. Welcome. He was here yesterday. On a serious note, you're welcome here anytime. I'm going to open it up for questions, and because we have a visiting committee and we were raised very well, they're going to go first. Are there any questions?
Thank you, Madam Chair. Thank you, Madam Chair. We don't have any questions, just to say we support the bill, and we thank you very much for presenting it. And Partridge Carr, Delegate Carr on our committee, also is a co-sponsor for Ways and Means. Thank you.
How about you, sir? Any questions?
Good. Thank you.
Okay, thank you. Any questions from the committee? I'm going to Delegate Woods and then Hill.
Thank you, Madam Chair.
You're welcome.
My question is this. I'm keep hearing people talk about what they believe to be damages from having these types of services provided in the schools. Is there any, because I certainly haven't seen it, is there any documentation that says that it is having an adverse impact on children when they can receive these services, in light of the fact that we know that some kids aren't able to articulate some of the concerns that they have or are going through in the home environment?
To my knowledge, Delegate, there is absolutely no evidence of any negative impact on students for any of the services. And in fact, for most of the families involved, this is a blessing to have these services in the schools because they know that their child's needs are being met during a fourth of the day that they spend away from the house. So I think it is only positive.
May I have a follow-up, Madam Chair?
Yes.
Thank you. So then we don't have any data that says that there are parents who are saying, I don't want my kids to have these services. I think that it's going to be adverse. To your knowledge?
To my knowledge, no.
Thank you so much. Thank you, Madam Chair.
You're welcome. Delegate Hill, followed by Shalega.
Thank you, Madam Chair, and thank you, Madam Vice Chair, again, for a good bill.
Bless you.
So there's a fiscal note for personnel, right? Do you have any idea if all the pins at MDH and all the pins at the Department of Education are filled, and so they actually need an additional pin to do this? Or do you know if they have unfulfilled pins that if they would just fill it under their current budget, they'd have the personnel available to do this work?
I don't know that, but I can certainly seek that information out.
Okay, may I follow up? So there were some amendments, you won't get a chance, from Horizon Foundation, and amendments also from the Maryland School Psychologists Association. Are those amendments acceptable to you?
Yes.
All right, thank you.
Questions? Thank you. All right, any other question, Delegate Shalega?
Thank you, Madam Chair.
welcome.
Just to follow up with what my colleague to my right
Down the
was
road.
saying, is there an age at which children are allowed to get these services without parental notification and permission?
Most of these services are covered by individual education programs, which parents are involved in the development of and sign off on. So all of these health services are, well, not all. The school nurse part is not. I'm just talking about the auxiliary services. But the school nurse, the parents know that the school nurse is there, but the child can go there when they need to.
But again, not needing for psychological, mental health, or physical health, there is an age of 12.
Right.
That children can go get help without their parents' knowledge or permission. Is
Right.
that correct?
Thank you, Delegate Bagnell. Yes.
Thank you.
All right, you have helpful friends on the committee. I wonder why. All right, any other questions? Seeing none, thank you, Delegate.
Thank you.
We're going to go to the virtual witnesses. Will you be so kind and bring them up, please? Yes, thank you. And while we do that, I want to say that the next bill that I'll call, because there's only two witnesses, is Delegate Grammer and then Delegate Schindler. And thank you both for being patient and waiting. And everyone else that is waiting, thank you for your patience. Attorney General, we will do you after they go. Okay, they only have two witnesses. Good afternoon. Ms. Elliott, will you please start your testimony? Ms. Elliott, can you hear me? If so, will you please start your testimony?
Can you hear me?
Thank you. Yes, I can.
Wonderful. Thank you so much.
You're
My
welcome.
name is Liz Elliott, and I'm here as a practicing school nurse. I live and work in Montgomery County. I also am the president of the Maryland Association of School Health Nurses, and I'm happy in conjunction with Robin Elliott to share our voice and our experience, and would like to emphasize the importance of data in identifying our workforce needs. When school nursing got its start in the 1900s, Lena Rogers was one of the first nurses. And what she did just from one person was to significantly drop the number of absent students from 10,000 to just over 1,000 in a year. A remarkable success that was measured and specified to help us as school nurses know our impact. So we need the data again to further identify where are the gaps. We are in a critical nursing shortage in this country, absolutely 100%. But we don't know how that impacts school health. And so I urge the committee members to urge support for this bill so that we have the data that we need to become more successful. It's very clear that students need to be healthy and safe to be ready to learn. And again, I just very much urge this committee's support for this bill so that we have a better understanding of where the gaps are. And I'm also want to send my apologies for Mother Nature. Driving in from Montgomery County is not really a good decision today. So I very much appreciate the opportunity to be here in this way and welcome further questions. Thank you so much.
So the question that the entire committee has, including Ways and Means,
Yes.
are you related to Robin Elliott?
Oh, I forgot to say that. No, actually, we're still working on to see if we might be fifth cousins. But we
Okay.
have not found an immediate relationship. It is just completely happenstance. So yeah, no relation.
All right, that would have given you brownie points. Just kidding.
Well, yeah, maybe
All right.
next time I'll have to research it and I'll let you know.
Okay. Let's move on. Are there any questions for this witness? Seeing none, thank you so much for being with us. We appreciate
Yes,
it.
very much appreciate the time and the flexibility to be virtual. That was really helpful today.
You're welcome. May I please have the others, please? The other witnesses?
They're all here. They just need to turn on their video.
Okay, so why don't we, all right, let's start with Rajan. Can you hear me? Would someone just mute? Go ahead.
Yeah, here we go.
Hello, can you hear me?
Yes.
Great. Well, I'm ready to get started now.
Yes.
Good afternoon, members of the Health and Government Operations Committee and the Ways and Means Committee. I am Rajan Bell, a junior at Wheaton High School in Montgomery County, Maryland. And on behalf of the Montgomery County Student-Led School Health Council, I urge you all to vote favorably on House Bill 672. The passage of this bill will continue to ensure the quality of our state's school-based health and wellness centers, which have been essential in supporting students in times of need. I've experienced this positive impact firsthand. Throughout my time at Wheaton, I found myself stressed, anxious, and frustrated on numerous occasions. These emotions stem from both in-school and outside of school challenges, such as conflicts with my teachers, friends, fragile family dynamics, and a lack of confidence in my own self, compounded by traditional attitudes that discourage boys from experiencing and expressing their emotions. I've struggled to properly address these negative effects they've had on me. In my sophomore year, I had a friend who invited me to a support group at our school's wellness center. It's called Courageous Kings. It still operates today. At our weekly sessions, I was encouraged to not only share my experiences, but explore how they've affected me personally and my own development. Throughout these discussions, I learned that being a man didn't make my feelings any less valid than anybody else's. And I thank Courageous Kings and the Wellness Center for providing me with that lesson. Wellness centers offer more than just support groups, however. They provide students with access to sports physicals, allowing them to participate in interscholastic sports, prescription medication, and the diagnosis and treatment of certain conditions, especially when they can't get to a doctor or pay out of pocket themselves. Despite the greatness of wellness centers, not everybody has access to them. Wheaton is one of 6 MCPS high schools to have one, which leaves students at the 19 other high schools without the same degree of health services. Furthermore, enrollment is limited to only students at these schools, further excluding MCPS students. The potential of this bill to address this disparity, as well as many others in the state of Maryland, is why I'm advocating for it. By collecting data on the amount of health and wellness personnel at each school, we can get a better idea of where disparities lie and how to best address them. Additionally, requiring annual reports on the findings will promote transparency and accountability during this process. I urge you all to support this bill, and thank you greatly for your time.
And thank you for being here, and your parents must be very proud of you. Thank you for sharing your personal story, okay? And that goes to all of you. Why don't we go ahead with Dosho?
Thank you. Good afternoon, Madam Chair, Vice Chair, and esteemed members of the Health and Government Operations Committee. Thank you for allowing me to have the opportunity to speak on behalf of House Bill 672. My name is Rubira Dosho, a senior at Montgomery Blair High School. I'm here representing the Montgomery County School Health Council Student Subgroup, Our group is devoted to advocating for the wellness of students throughout our county, as well as in a broader context for the state. We maintain a firm commitment to ensuring that all students have equitable access to wellness resources in a school environment. The American Academy of Pediatrics recognized the importance of school nurses and school wellness personnel in promoting the health of children. But this is rather obvious, I feel like, yet there remains alarming variability in how school health staff are distributed within school districts as well as across the state, as highlighted by the Kerwin Commission's results. My neighborhood in Langley Park and Silver Spring have served as a driving force and a place of inspiration for my advocacy journey. As a result of an interview series I conducted with students at my school, as well as our Spanish language coordinator regarding the Access to Care Act, I learned that some students worked manual labor jobs on the weekends, as well as outside of school to support their families, and relied on home remedies as well as unlicensed drug usage to deal with injury and bodily stress on the job. The passage of the Access to Care Act was a major leap towards creating a space where any Marylander, regardless of immigration status, can receive treatment. But all the daunting challenges of being a migrant teen, getting the care they need, and knowing where to go for support on top of familial responsibilities can be overwhelming, as well as juggling education. Often migrant teens like myself can be the only English proficient members of their family and are often in charge of educating their families on resources and news without an adequate support system at school, supporting wellness in and outside of school, and educating students on resources. Many of these resources may not be taken advantage of. I support House Bill 672, which would conduct further analysis and data collection on school health nurse personnel, because not all students have the privilege of basic access to healthcare opportunities outside of school spaces, leaving them with limited physical and mental healthcare options. This bill would provide legislators, future school wellness advocates like myself and other students on this call, and local agencies with the holistic knowledge to achieve an environment where students can all achieve the necessary physical and mental health support that they need, just as any other student in their classes would. The bill also adds a role for a school nurse representative on the Maryland Council of Advancement of School-Based Health Centers, further representing the challenges and successes of student wellness in our schools. Because of this, I humbly ask for a favorable vote and support in passing this bill. Thank you for your time and consideration, and thank you, Delegate Carlson, for your continued support for the student voice.
And congratulations on you getting a full ride, right, to Columbia University. Is that correct?
Yes, that is correct.
Congratulations to you.
Thank you.
We're very proud of you.
Thank you.
Next, please, Mr. Rafay. Did I pronounce your last name correctly? If I didn't, you feel free to correct me.
Yeah, no worries, Rafai. But thank you so much for taking the time to be
Wonderful
here.
to have you.
Thank you. So, good afternoon, members of the Health and Government Operations Committee and Ways and Means Committee. Thank you so much for your time. My name is Azimula Rafai, and I'm a student in Montgomery County. Through my work with the Montgomery County Regional HGO and the Maryland Association of Student Councils, I've spent years advocating for student well-being, not just as a policy issue, but as a real human issue. Behind every statistic is a student, a family, and a parent forced to make impossible choices because of gaps in our system that must be addressed. These gaps have gone unaddressed for far too long, and House Bill 672 is the first step in changing that. In fact, I want to share the story of a family friend, a single mother from a neighboring county who had to choose between her working hours and her child's health. Her son needed medication at school, but there's no full-time nurse. Every day without a nurse, she sacrificed working hours, staying nearby in case of an emergency. She compromised her income, security, and peace of mind, all because she had to prioritize something that should have never even been in question in the first place: her child's health at school. No parent should ever face that choice, yet this is the reality for thousands across Maryland. Across counties, there are vast disparities in opportunities in healthcare that we cannot accept, and we must research these disparities, especially when it comes to the health of our students. Unfortunately, this is just one example of a gap that must be addressed and researched sooner rather than later. House Bill 672 achieves just that. This bill is not any ordinary bill. Rather, it is a step towards protecting Maryland's students. By assessing gaps in school health personnel and ensuring that experts, such as school nurses and pediatricians, are at the table shaping solutions, we can finally take action to support our citizens in Maryland, just like the single mother, making ends meet and worrying for her child's health. Our schools should not be a means of worry, and they should be a safety net, and families should be able to trust our system set in place, but this will never happen unless we act now. With that, we, the students, urge you to issue a favorable report on House Bill 672. Thank you so much.
For these witnesses. I don't see any questions, but I do have to tell you that, wow, I feel so good about the future. You all three are just so eloquent. And thank you for being here and for making a difference, okay? I hope your day is blessed. We do have one witness left, and it is Mr. William Kress. Are you here? William Kress, is he virtually? No? All right. This actually concludes the bill hearing on House Bill 672. I want to thank the Ways and Means Committee for being here. You're always welcome. And now we're going to go quickly to Delegate Grammer, House Bill 547. And this is Hospitals Price Transparency Requirement and Fund. Welcome. Thank you. You're welcome. Yes,
there
right
we
there.
go. I'll get started with your permission.
Thank you.
Madam Chair, Madam Vice Chair, members of the committee, for the record, Delegate Robin Grammer here to present House Bill 547. House Bill 547 puts in place enforcement for the hospital price transparency laws enacted by the federal government. Controlling and lowering the cost of healthcare is a goal we all share. The federal statute on hospital price transparency is aimed at helping us achieve that goal. Under the federal statute, hospitals and healthcare systems are required to provide lists of hospital charges so patients can compare prices across the system. Unfortunately, most Maryland hospitals are non-compliant. To help with compliance, both red and blue states across the country have been adding enforcement mechanisms at the state level, and that's what this bill does. House Bill 547 puts in place mechanisms for the Department of Health to enforce the rules and creates a fund for this purpose. I've read the testimony from the Department of Health that they don't do this typically and wouldn't be the appropriate agency to enforce these rules. I'd leave that to the wisdom and knowledge of the committee. If we decided to give that to another agency, maybe the HSCRC, with that I'd be happy to take questions, and I'd ask for a favorable on House Bill 547.
Thank you, Delegate. Are there any questions for this delegate? Delegate Shalega.
Thank you, Madam Chair. Thank you for bringing this bill. What can you tell us about what other states are doing? I think that we're not inventing the wheel here.
Yeah, we're not reinventing the wheel at all. And again, the requirements are federal requirements. But what they found is the CMS isn't really a great enforcement mechanism at the federal level. So, for example, states like Colorado, Ohio have been passing almost identical legislation at the state level to say, okay, we have these state level agencies who are responsible for ensuring that their systems follow the regulations. So it's a federal governing statute, state level enforcement, states like Colorado and Ohio.
And one more, Madam Chair.
Sure.
How will this help patients?
So I'm old enough to remember in my primary care physician, when he'd invite us in and he'd sit us on his couch in my doctor's office, he would actually sit on the phone and negotiate costs with patients. My doctor's office was in Dundalk, not a rich community, and he'd literally have patients on the phone saying, if you can't afford this bill, why don't we do $15 this week, $15 next week, and $15 the week after that. Of course, that was before HIPAA. But the overall point is we used to have competition and cost containment mechanisms that helped drive prices down. Now everyone tends to be in a pool, everyone gets care, but what this bill does is says, look, we're going to actually we have these requirements so that consumers, patients understand the prices they're going to face when they go to the hospital. And we're going to enforce that to ensure all the hospitals are complying so that no matter what hospital you want to go to, you can compare prices across the state.
Thank you.
You're welcome. Next, I have Delegate Bandari and then Chisholm.
Thank you, Madam Chair, and thank you, delegates, for this wonderful bill.
Thank you.
My understanding is our global budget model already standardized hospital rates at SCRC, and while federal transparency law exists, the CMS compliance And I was reading the report from Johns Hopkins. It is not, it is uneven. This bill aims to strengthen enforcement. We got that. But given our unique hospital funding structure, how do we ensure that additional state-level oversight meaningfully improves patient access to information without creating redundant or conflicting regulation for our healthcare system?
Well, I would start by saying this actually doesn't create a redundant system. It just requires the hospitals in our state to comply with the system that's already in place that the hospitals are not following. And what was the second part of your question?
Like, meaningfully improves the patient's access to information.
Yeah. Even though we have a bit of a unique system, there's actually a large variability in the prices that can be offered by any hospital. What I would, this is, the regulations cover so broadly and the requirements that we give to hospitals are so wide. What I'd recommend you do is go to patientrightsadvocate.org to kind of learn how the federal requirements help patients understand broadly the costs they're going to experience at hospitals. And what you'll see is a lot of that information, which should be provided by Maryland hospitals, is not, which really prevents patients and consumers in our state from finding what the prices are here in our state.
One more question.
Sure.
Yeah. I don't disagree with the intent of the bill, but in the meantime, this global budget model exists to address the concern about price variability. You know, like all the hospitals bring how much budget they have in the beginning. So this is a very standard model. So did you look at that, how it is going to impact the price variability if you?
Yeah, even though, as you know, even though we do have a standard model, even though the state does set a lot of the rates hospitals have to offer, there is a lot of variability between hospitals, and there are a lot of rates that are not set by the state. So there's quite a bit of fluctuation between hospitals, and what the federal statute requires is not only the costs that the state sets be included, but the variable rates that the state does not set also be included.
Thank you.
Thank you.
Okay. Delegate Chisholm.
Thank you, Madam.
You're
Thank you, Madam
welcome.
Chair. I understand the motive behind the bill, but I guess my question is the final intent of the bill really to provide more transparency so that the patient has greater options or choice? Because we do run a very unique model, we'll call it unique, because it feels like in the state of Maryland, there's not a lot of choice, but where there is choice, it seems to me like the patients aren't aware of that choice. Is your goal to maybe make this more apparent to our patients so they do have at least some choice, even though a lot of the rates are set?
Absolutely. You know, for any market to function, you have to have price discovery. Without price discovery, you don't have a market. And as I mentioned previously, a lot of the mechanisms that the federal statute provides to help achieve that, the reports are on a state-by-state basis. And if you go to patientrightsadvocate.org, it shows how most hospitals are non-compliant, but even the ones that are don't have correct pricing data sufficiency ratings. So it's the way the system is currently operating without an enforcement at the state level is really not sufficient for doing that.
Right. Thank you. Thank you, Madam Chair.
I think I just want to correct the record. Did you see the fiscal note?
I did.
Page 6?
Yes, ma'am.
It
Page
states
6,
that
I'll go there.
Maryland Department of Health advises that of the 63 licensed or certified hospitals in the state, only one hospital has been in non-compliance with the Federal Hospital Price Transparency Program since 2021. MDH assumes that under the bill, one hospital per year may be non-compliant and required to pay administrative penalties. Therefore, MDH estimates there will be approximately $29,000 in special fund revenue for the Hospital Price Transparency Fund annually beginning in early fiscal 2026. But the sentence that I wanted you to be aware is the one that starts with advises that of the 63 licensed or certified hospitals in the state, only one has been in noncompliance with the Federal Hospital Price Transparency Program since 2021. The hospitals are also going to be testifying after you, but I wanted to see if you have read that sentence.
I did, and how I would respond is that the folks at Patients' Right Advocates, they audit yearly, and when they did their Maryland study, there is a significant amount of noncompliance by every hospital they've looked at. So while we have hospitals like Holy Cross Germantown and Holy Cross Hospital in Silver Spring, which are for the most part compliant, there still continues to be a major amount of noncompliance.
I think that it depends on how you're defining non-compliant, right? Because the advocate groups, what I experienced in the committee is that they look at things outside the law, but this, according to MDH, there's only one, but we can check that out, and I'm going to be asking that. I wanted to also ask you, did you meet with the HSCRC before the bill hearing?
I did not.
Okay, did you meet with the Secretary of Health before the hearing?
I met with advocates from MDH about the bill.
No, not the advocates, the Secretary or the Deputy Secretary.
I don't believe so.
Okay, will you be so kind and meet with them?
The
Because
Secretary and Deputy Secretary.
we have, the acting secretary is Dr. Moran,
Okay, gotcha.
and the HSCRC is Mr. John Crum and Deb Rifkin. And so what we do in this committee is that before we come, we try to meet, we're big on compromise. We try to meet with everyone to try to compromise on the language. So if you can meet with them, that would be
Sure.
great. And then you
Absolutely.
can compare what you have with what they have and see if there's any room for amendments and to
Sounds
work
good.
it out, okay?
Thank you.
My pleasure. Delegate Hill, followed by Delegate Kaiser.
Thank you, and thank you, Delegate Grammer, for the bill and what you're trying to achieve. I need a little guidance. There's a lot of, whether it's the waiver or whatever, showing prices is really important in a lot of commercial areas. One of the problems that I'd like you to tell me how this is going to help is that the pricing is not the cost to the patient if the patient's using insurance, right? So and those costs are negotiated depending on the plan. And there are plans that participate with some hospitals and not other hospitals. If a patient's paying completely out of pocket, whether it's an elective procedure or they just have no insurance, then pretty much that sticker price that you want them to show. So what kind of transparency, because I don't think this bill doesn't have, would you put in to make sure people actually know what they're going to pay? Because this does, what the hospital charges, particularly since the charges are uniform across the state, which is what they require, that it has to be the same charge at every hospital for the same procedure.
I think you're getting at the nature of how complicated it is to provide all the information, and I think it's a little bit of what the chair, the differentiation between the fiscal note and what the advocates are saying. A lot of information, for example, making sure the data is appropriately formatted, and making sure that the items and services are described in a way that the average consumer can actually read them. The codes for all of the services and rates. A lot of those things are that's what's in question by the patients, right, folks? And just because, you know, some of the information is provided in a way that's mostly readable to, you know, our system here in the state, I think what a lot of folks are saying is for the average consumer, it's still not presented in a way that's appropriate for them to make decisions for their personal health care.
So how does this bill give the consumer the information they want if it's just saying, tell us what you charge for an appendectomy, tell us what you charge for one night in the ICU, and if you have 5 blood tests versus if you have 7 blood tests 3 times a day, plus an EKG, how does that work?
So you'd have to, it's largely what should be audited by CMS, but which is not, the federal government's frankly not, the federal government's proven not to be an effective enforcement mechanism for this issue. The bill kind of goes over the price, the list of services that have to be covered, which hospitals have to be covered, in what scenarios. But these are things that are in the bill that really we're hoping whatever agency takes this on can really ensure that they're getting at that data.
Okay, thanks. And can you give me the, I tried to Google patient
I'll send it to you.
advocacy, and they're not
I'll send
coming
it to
up.
you.
Thank you. Thank you, Madam Chair.
You're welcome, Delegate Johnson, and thank you, Delegate, for being patient as we ask these questions.
Sure,
okay?
absolutely. I appreciate it.
Delegate Johnson.
Thank you, Delegate Grammer, for the bill. Can you get the committee the list that you held up?
Yeah, what I'll do is I'll email the whole committee. Yes, absolutely.
Thank you.
Thank you,
Madam Chair.
You're welcome. Any other questions for the delegate? Delegate, I was looking for the letter from the Hospital Association because I like to give you an opportunity, since you won't come back, to address it. And what they're saying is that they're saying that the proposed legislation, although clear in its intent to enhance accountability and consumer protection, has duplicative provisions that might create unnecessary regulatory burdens without providing any meaningful benefits for patient. We're concerned that some of the bill's provisions differ from the federal regulations, thereby inviting confusion among providers and patients. Similarly, CMS already enforces several oversight mechanisms to ensure compliance by hospitals. This legislation creates requirement for additional state-level enforcement corrective penalties. And the proposed timelines and processes for monitoring also seems to differ from federal standards. What will you say to that?
Yep. So when we drafted the bill, what we largely did is we took the federal regulations and we said we're going to put them in state law as best we can.
Yeah.
So if the bill is not perfect or some of the time frames don't make sense, and we all wanted to change that, that's something I'm more than willing to listen to the hospitals on. Frankly, I think those things are all very workable if the committee's interested in the bill.
Okay. And then they said hospitals in Maryland operate, which is what some of the members were getting to, on a global budget model wherein the Health Service Cost Review Commission sets hospital rates for all payers. And Maryland is unique, as you know. As such, hospitals do not negotiate different rates with different payers and cannot engage in any price discrimination. This unique rate-setting system already ensures a high level of price transparency and cost control in Maryland compared to other states. This model also ensures that all patients can access any Maryland hospital regardless of their ability to pay or insurance status. What will you say to that?
Yeah, I think that goes back to Delegate Bondari's questions. And even though we have universal rates that are set by the state, there are a lot of fees that will be on the ultimate receipt of the consumer that aren't fixed and that do vary, frankly, sometimes significantly. So if it's a technical detail we have to close for that, I'm open to doing that. But I think both the fixed and variable rates are what this kind of legislation aims to get at.
If you will be so kind and meet with the people I suggested and see what you can do.
Yeah, absolutely.
And
Appreciate your
if you're
recommendation.
able to work something out, the committee is always open.
Appreciate it.
Okay? And thank you for your time and your patience
Thank you so much.
today. My pleasure. I next have Jake Whitaker for the Maryland Hospital Association, and this is an unfavorable panel.
Thank you, Madam Chair and members of the committee. Jake Whitaker on behalf of the Maryland Hospital Association, here to testify in very respectful opposition of House Bill 547. Maryland's hospitals and health systems support the goal of improving price transparency in healthcare costs, but we are concerned that this bill, although well-intended, is duplicative of existing federal requirements. Maryland hospitals already make prices available for patients. As healthcare transactions can be very complex and often include multiple payers, our hospitals do provide online tools to help folks navigate those costs. So for example, if a patient is looking for a particular service, they can type in their insurance information or whether or not they have insurance, and then also select the service, and then the process spits out a price for them. In 2021, CMS also issued a rule requiring these hospital price transparency rules. And obviously, we're already in compliance, as MDH mentioned in their fiscal note, with those federal compliancy rules. And finally, I would just note that some of the enforcement mechanisms are already duplicative of the federal enforcement efforts. CMS already enforces several oversight mechanisms to ensure compliance, with some of the enforcement mechanisms being fines of up to $2 million per year. So for the aforementioned reasons, we respectfully request an unfavorable report on House Bill 547. Thank you.
I'm going to open it up for questions now from the members. Delegate Shalega.
Thank you.
You're welcome.
Where do we put that information in that you mentioned in your testimony?
Yeah, so you can go to a hospital website. It'll ask you for your insurance information, and then you can select the service that you'd like, and it will give you a dollar figure for that cost for that service.
Okay, and I do know, I have a good friend who had a baby in utero that had some heart problems, and her insurance did not pay for these very detailed sonograms that she needed to have done. And she shopped around and literally saved $1,000 by going, but it was a lot of work. She couldn't just put it in. And I think that's what this bill is trying to get at. When you have a procedure that your insurance, may or may not cover, maybe it's less in one facility than another. Is there a way to do that?
Yeah, and I think that's why these tools are so important, because it gives you the option to say, I'm not covered by insurance. So you can kind of get a sense of what that cost would be if the insurance company doesn't cover whichever service that you're looking for.
Okay, so I can go to my hospital, put it in. I'll let you know how it
Yeah,
works.
but I can send you a few examples if you'd like to.
Okay,
Great,
thank you.
Everyone, because she likes
Absolutely.
to share.
Absolutely.
We share in this committee. So any other questions for this witness? All right, this actually concludes the bail hearing. Excuse me? Oh, I'm sorry, I did not, did you just put it on?
Sometimes slow at the
Okay, it's all
button
right.
pushing thing.
Want to make sure
'Cause
I
have to
wasn't
think
losing
about
my
it.
cool here. Go ahead.
Thank you. I'm not clear, and because I haven't had a chance to be super thorough on reading this, what constitutes a hospital. So, for example, and I have not talked with her at all, so I don't know, the question that she just asked with, that my colleague just asked with regard to the sonograms. My thought would be, well, you're probably not getting that done in a hospital. You're getting that done possibly in a doctor's office or an outpatient clinic or something like that. So I just want to make sure we're not doing apples and oranges when talking about that. And sort of maybe making it a clearer question or an easier question, could you give us some examples of where hospitals would possibly have variable rates? Because that appears to be one of the points here.
Yeah, absolutely. I'd be happy to provide some examples. And then to your, what was the first question? I'm sorry.
About just what sort of constitute, in this space, what does a hospital mean? Because,
Yep. So I'd have to
there are
double check.
different things out there.
Absolutely. I'd have to double check the bill, but I believe it's as defined in Health General. And I'd be happy to share that so it can kind of differentiate from some of the other, like, for example, freestanding medical facilities and things like that.
Right, where maybe maybe those types of facilities have more ability to have variations in cost. I don't know.
Yep, they're not subject to constraints of the model and everything like that.
Thank you.
Great, thank you.
So, and on page 5 of the fiscal note, it says, on the current law, hospitals means an institution that has a group of at least 5 physicians who are organized as medical staff for the institution, maintains facilities to provide under the supervision of medical staff diagnoses and treatment services for 2 or more unrelated individuals, and admits or retains the individuals for overnight care. Actually, it's the first time I see it in a fiscal note. Thank you. Any other questions? Those are great questions. If you will give whatever you provide to the delegate, provide to all of us, please. She also likes to share.
Absolutely.
Okay, thank you. So this actually concludes the bill hearing on House Bill 547. Next, we're going to go on to, and the Attorney General has been, actually, we're going to go to Schindler because he only has 1 witness, and then we'll call the AG's bill. So that is the next bill. What was it? 1 second. We're going to House Bill 519, Delegate Schindler, and it is titled Public Health Hospitals Parking for Patients. How are you?
I'm well, thank you, Madam Chair.
Good, and it's your first time in this committee, right?
It is.
Welcome.
Thank you very much.
All right.
Madam Chair, Madam Vice Chair, honorable members of the committee, thank you very much for the opportunity to testify today. For the record, I'm Delegate Matthew J. Schindler, and I'm here to present House Bill 519. Now, House Bill 519 is very simple, and there is no state fiscal note. House Bill 519 would require hospitals in Maryland to provide free parking for patients receiving inpatient or outpatient care for the duration of their visit. While current parking fees may seem minimal, a few dollars an hour, these costs can quickly add up, especially for patients requiring extended hospital stays or multiple visits within a short period of time. The average cost to park for a full day is $10 on average, adding yet another financial strain on patients already juggling expenses like co-pays and lost wages. At a time when the cost of living continues to rise, Marylanders should not face an added burden simply for accessing necessary and often life-saving medical care. This issue disproportionately affects our most vulnerable populations: low-income individuals, those with chronic illnesses, and elderly patients, who all already bear the brunt of high medical costs. In 2020, the average out-of-pocket health care spending for privately insured Marylanders was over $5,000 per capita. Adding parking fees on top of these expenses only deepens the financial strain. Now I'm going to veer off of my prepared testimony for a moment to address what are likely some concerns of the Hospital Association. As a former municipal official responsible for maintaining and running parking garages and calculating and planning the cost per parking space for construction of a new garage, I'm not unsympathetic to the challenges of maintaining a self-sustaining parking system. I'll clarify as well, we are not asking for hospital garages to be free to the public or for free parking to be provided to visitors or staff. This bill only applies to patients who are using a car as transportation to their appointment and only for the duration that they are either an inpatient or outpatient. Validated parking is not a new concept, and nearly every parking garage already has the capability to accept parking validation. Several hospitals are already offering validation for discounted rates for their patients. Our bill provides the flexibility for hospitals to implement this however they choose. And while I acknowledge that this will have a financial impact to our hospitals in the state, House Bill 519 would provide a permanent relief to Maryland patients, ensuring financial barriers do not prevent access to essential hospital services. Patients should be able to focus on their health and recovery, not on how long they've been parked in the garage. I'm aware that the Maryland Department of Health's request for an amendment to exempt their facilities, as they already provide free parking, and I would consider this a friendly amendment to the bill. For those reasons, I respectfully urge the committee to issue a favorable report on House Bill 519. Thank you so much for your consideration.
Thank you for being here. We appreciate it. Are there any questions for the delegate? Wow, you have a lot of questions. We do this for people that come here for the first time. But on a serious note, look at him. That is priceless. Okay, the real question is Delegate Hutchinson.
Thank you, Madam Chair. Hey, Delegate, it's nice to meet you. I haven't had a chance to say hello to you. It's been a busy start, so I look forward to getting to know you a little bit more. You're out in Washington County. Meritus is in Hagerstown. I just checked online. It looks like they provide free parking out there.
They do.
I represent the Eastern Shore. Most of the suburban hospitals provide free parking. So we're probably looking at the medical centers that are in the city, probably specifically Baltimore City. And I saw that there's some, while there's not a financial note to the state, there is a financial note to our hospitals. So in the case, I think it was either University of Maryland or Johns Hopkins says this could cost them $4 million a year. With hospitals that are faced with very, very minimal margins today, how would you expect them to make up that lost revenue?
This bill was purposefully written in a way that it allows the hospitals to kind of decide how to implement that. Certainly we would not ask them to change or open up the parking to the general populace just for the patients themselves. So visitors, staff, anybody else that utilizes if they own the parking facility. So I mean, it's sort of open-ended as to how the hospitals would implement that. But I agree, it would primarily affect those in the more urban areas. We're blessed in our areas to have facilities that do offer free parking for patients.
Great, thank you.
Yes,
Welcome.
sir. Thank you.
Any other questions for the Delegate Woods?
Thank you, Madam Chair.
You're welcome.
So the question that I have is, are there any concerns for a hospital who deems a person to be prepared for discharge but does not recommend that they drive themselves home? Would there be any liability concerns?
Are we assuming that that patient drove themselves to the hospital then?
Based on what you said, based on your testimony, you're saying if they drive them, am I correct?
Right,
They
so
drive
this bill
themselves to
would,
the hospital, then they're ready for discharge, but, because I've had it happen, but the hospital, and I'm hard-headed, I didn't say that, but the hospital says, we don't think that it's safe for you to drive yourself home. Would there be the possibility of any liability concerns because they drove themselves there, hard-headed people?
I mean, that would be an interesting, I think, amendment to add to this, to create some sort of a caveat for what to do in the situation where a patient drove themselves and is unable to drive themselves home. Thank you for that.
Agreed. Thank you. Thank you, Madam Chair.
Patient and for being with us today. We appreciate
Thank you so much.
okay?
Yes, ma'am, thank
You're
you.
welcome. And if I can ask you, Delegate, have you met with the hospitals?
No, just the Department of Health.
All right, if you could meet with the hospitals, please? And just see where you can get, just talk to them, okay?
Yes, ma'am, thank you.
You're welcome, thank you. And they're right they're right here to make it easier for you. Can you raise your hand, please? Raise your hand, Andrew. All right.
He's parked right here.
Oh, he's, so you can meet with him afterwards, okay, Jake? All right, we do have one unfavorable before we conclude this bill hearing, and that is the Maryland Hospital Association. Yeah.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. My name is Jake Whitaker on behalf of the Maryland Hospital Association, here to testify in respectful opposition to House Bill 519. As Delegate Hutchinson mentioned, this will have a significant financial impact on hospitals. Maryland hospitals operate under an all-payer hospital rate-setting system, which requires careful management to ensure that resources are directed towards patient care. Requiring free parking without a funding mechanism will divert critical dollars away from these hospital operating budgets. There's also some additional complexities with this bill, where some hospitals do not own their parking facilities, but instead they lease space from private entities. These agreements often include financial obligations that cannot be unilaterally altered without renegotiation of those contracts. So this bill does not address how hospitals should handle pre-existing contracts, which could create financial and legal complications for some of our hospitals. And then finally, I'll conclude that Maryland hospitals already have established financial assistance programs that include parking fee reductions or waivers for qualifying patients. A one-size-fits-all mandate fails to consider these existing efforts and the flexibility hospitals need to be able to support their patients in a sustainable manner. So for the aforementioned reasons, we respectfully request an unfavorable report on this bill. Thank you.
Are there any questions? Delegate Bagnall.
Thank you, Madam Chair, and thank you for being here. You had mentioned that some of the hospitals have a contract with private entities. Do the hospitals then receive revenue from those parking fees?
I believe it's a shared revenue agreement, but I can check on some specific details for some of those agreements.
And if I could have a follow-up. And how often are those agreements reconfirmed?
I could follow up on that as well.
Thank you. Thank you, Madam Chair.
Delegate Hill.
Thank you. We wonder if you could provide for the committee just, the number of hospitals or which hospitals offer discounts, which hospitals are parking for free regardless, and which ones, just along that whole route. We don't charge patients, we don't charge anybody, we charge a discount, inpatient, outpatient. But I think for me, the inpatient one is the really critical one. People come out of the hospital and they've been there for 4 weeks or 3 weeks or 2 weeks. So if you could just tell us what each of the hospitals already does and which ones have those contracts. We don't need to know the details, but how many have to have some kind of shared contract because they don't own their parking facility or they don't pay directly the people who manage them.
Got it. I'll do an informal survey of our members, and then if okay with you, we can get some aggregate information like X amount of hospitals provide free parking, X amount provide these reduced cost services and things like that, if that's okay.
If you could, if you're going to get us as aggregate, it would be good to know if it's discounted parking. Is it 25% off the day rate? Is it 50%? You know, how much is off the standard rate? And if you could also give us what that range of rates are.
Okay.
Okay?
And as always, we'll try to provide as much information as possible, too.
Thank you.
Absolutely. We'll just send it to everybody. Yep.
Send it, thank you. Any other questions? Seeing none, this concludes the bill hearing on House Bill 519. Next, we're going to move on to House Bill 728. Delegate Rosenberg, will you please bring your panel? I want to thank everyone that has been patiently waiting and who made an effort to come here today and who's online as well for being with us, okay? And for the delegates, thank you for your patience. And I believe that the Attorney General is part of your panel, and Karen Valentine as well. Will you be so kind and come up? And we're going to do 3 favorable, and for the committee, to be fair, then we're going to move on to the 2 unfavorable, okay? You can get started whenever you're ready.
Thank you, Madam Chair.
You're welcome.
I'm assuming that the Attorney General has been before this committee in the past.
He was here yesterday.
Oh, that's right. Okay.
I told him I'm going to charge him a fee. Go ahead. No, a key lime pie fee. We like key lime pie, right, guys? Okay, go ahead.
As this committee knows, because this is the committee that passed the bill, we created an opioid restitution fund so that the monies from settlements with those responsible for the opioid epidemic could be put to uses to try and address the problems caused by opioids. Otherwise, the money would have gone into the general fund of the state and could have been used for any lawful purpose. This is something that we had already done with the tobacco settlements. And we're here today because that litigation is ongoing. And the Attorney General came to me and asked that a portion of the money from the settlements go to the unit within his office that is responsible for this additional and ongoing litigation. And that's what this bill would do. That is the summary, and the General knows more about the specifics than I do, and I would urge a favorable report and defer to Attorney General Brown so that the committee can earn another lime pie.
Good afternoon.
Good afternoon, Madam Chair, members of the committee. I want to thank Delegate Rosenberg for sponsoring this bill, and thank you for being one of the lead sponsors, if not the lead sponsor, in 2019 when the Opioid Restitution Fund was created. I had sort of a flashback memory to when I was watching the movie The Martian, and remember Matt Damon's character he gives a lecture to the students after being stranded on Mars for 3 months, and he gives a short lecture and he says, "Any questions?" and every hand in the class goes up. Thank you for being here. I come before you with a simple but an urgent request, and that's to fund the opioid enforcement unit within my office using the very funds that enforcement unit has recovered on behalf of the state. Without this funding, our ability to hold opioid manufacturers and distributors and other bad actors accountable cannot be assured. So Maryland has secured, since 2016, $670 million for the state and local subdivisions. Over $180 million of that has already been paid, and $78 million has gone to the state for discretionary spending, primarily on abatement programs. The work has been done entirely by the attorneys in the Office of the Attorney General and investigators, not private law firms charging contingency fees. In fact, other states that routinely pay outside counsel, they pay on average 24% in contingency fee. If you do the math, if Maryland used contingency fee attorneys, we would have spent well over $100 million to recover that $680 million. We've taken a more responsible approach, ensuring that every dollar recovered is used for the public good. Despite our successes, the opioid enforcement unit receives no direct funding from the opioid restitution fund, and this is an unstable model. Think about it for a moment. I don't think you can find a single compliance program in state government, a single inspection program in state government, or a single enforcement program in state government where the monies that the inspection or the compliance and enforcement brings back to the state doesn't itself support that unit. Yet in this case, the opioid enforcement fund is funded out of my consumer recovery fund. We're asking that the opioid restitution fund support that unit. The governor has put money in the budget, Madam Chair, if I could just wrap up. Yep. The governor has put money in the budget, in his budget for this fiscal year. And for those of you who are familiar with the appropriation process and the cycle that starts in August, I gave 2 arms and 3 legs to get that $1.5 million in the budget, and I hope not to have to negotiate that one year after year, particularly since it makes so much sense that the opioid restitution fund support these attorneys. They're already employees of the state. They're already in the Office of the Attorney General. We're not talking about expanding the size of unit at all. It's budget neutral in the sense that, you know, it doesn't impact general funds. It's substituting one special fund for another. And with that, Madam Chair, I'll yield back the remainder of my time, as we say in Congress.
You actually owe me some time, but it's okay. Go ahead.
Good afternoon. My name is Karen Valentine, and I am a deputy in the Consumer Protection Division in the Attorney General's office. I oversee our opioids enforcement unit. I want to thank the chair and the committee for providing me the opportunity to testify in support of House Bill 728. House Bill 728 amends Section 7-331 of the State Finance and Procurement Article to specifically authorize the use of opioid restitution fund revenue to cover the operating expenses and personnel costs of the opioids enforcement unit. The unit pursues investigations and brings enforcement actions to discourage and stop illegal conduct, as well as recover funds for remediation of the opioids crisis. The unit has recovered commitments of around $670 to $680 million in recoveries for the opioids restitution funds, and more is expected. Although the law authorizes the use of the opioids restitution fund monies for law enforcement purposes and administrative costs, which would include the unit's work, House Bill 728 provides a more tailored authorization for the funding of the specific activities of the unit. The bill would support the unit's activities based on the benefits that the unit produces. The division requests that the committee give a favorable report for House Bill 728. Again, I thank the chair and the committee for this opportunity.
Thank you. I'm going to open it up for questions now. Delegate Martinez, and then Johnson.
Thank you, Madam Chair.
You're welcome.
And thank you, Delegate, for bringing the bill. And thank you, Attorney General Brown, for all the work that you are doing, standing up for Maryland's values every single day. And my question for you is, though, could you explain to the committee the history of funding this unit?
Sure. Thank you for the opportunity to explain that. So in 2016, my predecessor, Brian Frosch, he and a bipartisan group of attorneys general across the country said, hey, we got this crisis. We need to investigate and bring enforcement actions. So Brian Frosch created a very small opioid enforcement unit, and there was no money available, so he funded it with the only fund he had available, which was the Consumer Recovery Fund. And in the very first year, it was about $150,000, and I'm assuming that that was probably for an attorney and a non-attorney professional. So the unit has grown over the years. It's not an enormous unit. There are, I think, 5 attorneys, 1 non-attorney, or 2 non-attorneys. And we've been funding it ever since from the Consumer Recovery Fund. In 2019, when you created the opioid restitution fund. Had I been the Attorney General, I would have been testifying right here at that time saying, please insert a provision in that fund that ensures that the Attorney General can fund that out of that being the opioid enforcement unit, out of the opioid restitution fund. And I want you to think for a moment. I've got about 60 to 70 professionals in my consumer protection division. Because of budget cuts, I use special funds from the Consumer Recovery Fund to fund all of that work. Think about all the consumer protection bills that are important to the General Assembly. Online data privacy protection and AI stuff, and the work that we do to make sure that automobile dealers have fair pricing, and all the consumer, what are often unfair and deceptive trade practices. 70 people work on that. We've got the best consumer protection division in the country. That Consumer Recovery Fund is about, right now, $18 million. We bring in about $5 million a year. In 3 years, on the trajectory that we're on, and I know this is a budget committee issue, and I just came from my budget hearing before I came here. I know it's a budget issue. In 3 years, that Consumer Recovery Fund will be depleted. It'll be gone. So I'm asking for some relief here, not general funds, saying, hey, instead of having it, because the opioid enforcement unit doesn't put anything into the Consumer Recovery Fund, so instead of drawing from that fund to support this unit that's putting a lot more, right? I said 18 million consumer recovery, 180 million, 80 already to the state. I think it just makes more sense that we make that shift. Thanks for the question.
Delegate Johnson.
Thank you, Madam Chair.
Pleasure.
Thank you, Delegate, for the bill. Mr. Attorney General, if you can kind of clear it up for us, I'm not sure I'm understanding. Are you looking to have access to all of the opioid money? Or are you looking for percentage? Are you looking on an as-needed basis? And are you looking to fund your whole consumer recovery department out of that?
Thank you for the question. And anticipating what the chair is going to say, have I spoken to the advocates? Have I spoken to, so I think MACO is testifying, maybe the nonprofit beneficiaries of the opioid restitution fund? The answer is yes and yes. So I think you're going to see amendments, and here's what I think the amendments will be, and we're working them out. One is we're going to sunset it, right? 5 years, we'll come back and we'll demonstrate to you that we've been responsible with the use of this fund, so we're going to sunset it. The other piece is, and what we didn't mention in our affirmative presentation of the bill, is in that $670 million that we have obligations coming to the state, 180 has already come to the state, 80 million or to the state and local subdivisions, 80 million already to the state. Maryland is one of the few states, as I mentioned, that doesn't use outside counsel. So for all those states that use outside counsel where they're paying a contingent fee, those attorneys are kind of negotiating that contingent fee and that big pot of money. In our settlements, in recognition that there are states like Maryland that don't use outside counsel, we have negotiated what is called an additional remediation amount. And that is $12 million, it's 13.4, we've received $12 million for the cost of enforcement. The only problem is that goes into the opioid restitution fund and gets gobbled up with the rest of it. So we are willing to work on an amendment with the committee and the advocates to say, hey, you're only limited to what is available from that additional remediation amount. And while it's 12 million today, that doesn't mean that I get access to 12 million. I still have to go through the appropriation process every year. So when I submit my budget to DBM and they're going to say, oh, 6 people in the opioid restitution, opioid enforcement unit, how do you plan on funding them, Mr. Attorney General? And I'm going to say from the opioid restitution fund, because you see the authority that I was granted by the General Assembly. And so I'm only going to get it to fund that unit. And I can assure you, and I know some may think, well, are you going to build a 20-person unit? I don't need a 20-person unit. You know, we started with 1 or 2 people. We've got 6 people now. We are doing a bang-up job. And the other comparison point I'd like to bring, I think this is important. You know, Baltimore City has been doing an outstanding job in opioid recovery. And, you know, last year they they went to trial, right? They are appropriately aggressive. They went to trial and won 2, if I think maybe 3 cases, multi-million-dollar recoveries. And this is not a criticism, it's just a comparison data point. Baltimore City paid their attorneys tens of millions of dollars in contingency fee. And they needed to do that because they didn't have the capacity in their in-house to do that for them. We've built the capacity. 6 works for us. And we're bringing a lawsuit against CVS. We're the only state that is not settled because we're gonna take them to trial. And I can do that in-house, and I can do it for $1.5 million a year as opposed to tens and tens of millions of dollars that other states are spending. So that's why it's really important. Because the thing is, with the Consumer Recovery Fund drawn down, the fiduciary, I have a fiduciary duty, right, to manage my resources. I would have to discontinue funding the Opioid Restitution Fund because they're not contributing to the Consumer Recovery Fund, because I still have to do all that other consumer protection work. So then what would happen is I'd have to do what every other state does. I'd have to call up outside counsel and say, hey, I need you to do this on contingency fee basis. And then we're talking about tens and tens of millions of dollars. This is a value proposition for the state of Maryland.
Thank you, Madam Chair.
You're welcome. I have Delegate Bagnall, followed by Taveras, then Hill.
Thank you very much, Madam Chair, and thank you for being here. And I sort of want to follow on with Delegate Martinez. So this unit was established in response to the opioid crisis in Maryland, and it is a consumer protections unit specific to the opioid crisis. That's correct?
That's correct.
If we were to lose that enforcement effort, what would that do potentially to our opioid crisis in Maryland?
So I would have, I could make one of 2 choices, probably more than that, but the 2 that come to mind is, one is I just can't do opioid enforcement and we'd be satisfied with the $680 million of obligations. And there's probably, I don't want to set expectations, there's a lot more out there. There's a lot more out there in the pharmaceutical industry that we are looking at where we believe, and it's not just about collecting money. There are still bad actors in the pharmaceutical industry that are pushing excessive opioids through prescriptions into our communities. It's still happening today. So it's not only the money, but it's stopping that activity. So I'd have to either roll that back, which I wouldn't want to do, and I probably wouldn't do it, but that's one option. Or the other is go to outside counsel. And then for every dollar that I recover, I'm going to pay them probably 24 cents. So again, I'm not suggesting there's $670 million more out there, but I'm not going to say that there aren't either. But at $670 million, 24%, that's $160 million that I'd be paying for outside counsel, because I would not be able to do it in-house because I wouldn't be able to support that $1.5 million 6-person unit. I mean, just think, 1.5, 160 million. That's real. I mean, that is real. We can get you that on paper. That is real.
And if I can follow. Sure. And how important is enforcement to reducing our opioid overdose numbers?
It's extremely important because, again, it's still happening, right? It's still happening. Most of the litigation that you've seen has been through the manufacturers, right? And then the second round was the national retailers. And there's still actions being brought against national retailers. I mentioned CVS, what we're bringing, and 1 or 2 manufacturers, I think, that are still out there. But there's a lot of pharmacies, in-state and regional, that are, quite frankly, over-prescribing opioids. And we got to get them to stop. Right, we got to get them to stop. It's not just fentanyl coming in illegally into our communities. It is still through what is considered lawful dispensing of, prescription drugs. But when you over-prescribe, that's a problem. So we need to go after that. Now you're going to hear, and I'm going to hijack your question to answer a concern raised by the opponents. And I said we've been working through some. There is some disappointment with the Opioid Restitution Fund as it exists on the administration side. And I'm familiar with that because we talk to the Maryland Department of Health from time to time, and it kind of falls under the Maryland Department of Health. There's a little bit of transition going on in the administration, who's got the oversight. So there are a lot of concerns, like a lot of the nonprofit advocates who are doing good work in this space, like where's the money? It's not flowing fast enough. And that's probably true. And there are some other concerns that like, well, we applied for this or we don't know if we can use it for this. Those are important issues. That's not the issue that's on the table for this committee. That has to be fixed. And that's an administration, and we got to fix that. And I've made some suggestions on how to fix that. That's not what is on the table here. On the table here is money to continue enforcement, to stop the bad action, and to recover more money for Maryland so we can distribute more money to nonprofits and local government that's doing the great work in this area.
My pleasure. Delegate Taveras, followed by Hill.
Thank you, Madam Chair, and thank you, Attorney General Brown, for bringing this bill forward with the help of Delegate Rosenberg. I mean, I do have concerns because we do have other issues that we're trying to also tackle with that restitution fund for the people who do need assistance in recovery. And recovery for uninsured and underinsured is expensive in these treatment centers. And so I want to be assured that that we could be copacetic, that you're able to access funds to get what you need at a cost-effective manner, and that there are still needs for the local behavioral authorities across the state. How do you respond to the concern for that?
And I don't mean to be flip here, but I want to kind of I just sat through a bill hearing where you're talking about parking at a hospital. And I know this committee, it's Health and Government Operations. You are deep on hospital issues, nursing shortages and wait times in emergency rooms. So I'm coming in and saying, I need free parking, okay? And the parking, it does impact the patients, but there are so many other issues that impact patients in terms of quality of care, access to care, surprise billing, and things like that, that I would suggest look at parking, right? And is it an important thing that we should do? Should patients have the money that they need to be able to park free so they can take care of other things? And I'm not sure if I were sitting in your seat, I would be evaluating that in the context of long waiting lines in the emergency room. So, so why I say that is the issues that you raise are important issues. There are. Where is the money? Where is it going? And if I administered the fund, I would expect you to grill me on that. What is going on, Attorney General Brown? Why is that money not getting out? And I'll take that as a favorable amendment if you want me to administer this fund, because I really would administer it. I have ideas how to improve the administration of this fund, and I'll accept that as a favorable amendment. But this really is separate. This is about, the simple question is, do we want a low-cost, high-quality, and that's what I define as value. Do we want a value enforcement mechanism to ensure that we're putting bad actors out, that we're recovering for the state, so that the issues that you're addressing, Delegate, when we are flowing that money, we've got more money to flow. And I understand that right now there are some challenges in that money getting out. And I think that, look, I've got partnerships in government just like you, so I'm not throwing anybody under the bus in front of this committee. But there are others who have responsibility over the opioid restitution fund that I think could probably better answer, how to improve the efficiency of the fund.
Can I just say quickly, one more thing? Just quickly on just the type of drugs that, are we looking at just like Oxycontin, or are we also looking at xylazine and other drugs that you're looking to pursue?
Are we able to answer that? Okay.
We are looking at other drugs, but I can't say specifically which ones.
Thank you.
Thank you. So this committee is also looking at the ER wait time. We passed a bill last session that is actually the HSCRC, the hospitals and others are looking at that, and we had a briefing. So we are looking at all those issues. But what you're saying is basically 1.5 million as opposed to, paying $120 million, right? Because when we lawyers, when we're able to come up with a compromise and you settle, you get a third. When you go to trial, you get 40%. And there's a big difference, right? Because those are the fees and every other fees that we have, in the contract as well. So, that's great. Delegate Hill.
Thank you, Madam Chair. The first of my two questions, so I'm only left with the one. Thank you.
All right.
Because you explained it's only 1.5 million, and as the General Brown has said, that compares with the fees we'd have to pay otherwise. So thank you very much, and Delegate Rosenberg, thank you. As I'm reading some of this opposition, so I want to give you an opportunity. And as has argued, people are like, well, that's 1.5 million a year we won't have for the primary programs. But then Hopkins sends this letter saying, this is information, let me guide you. These are the principles that should be guiding this fund. And one was spend money to save lives, but would you agree that when you're able to collect funds from the lawsuits and the master settlement agreements associated with the epidemic, you are helping to spend money to save lives?
Absolutely.
So you're meeting that principle. Then they said, use evidence to guide spending. And I would think that if you're using your legal skills and your unit is concentrated on how we recover the money that's been promised, and you know the techniques that you are using evidence to guide the spending. Is that right?
That's correct.
Okay, so we're meeting at least 2 of 5 principles. And a fair and transparent process, so you're accountable for the funds that you're spending.
Absolutely.
How
Through
it's
the
being
budget
spent.
process.
So we're meeting at least 3 out of 5.
Absolutely.
Okay, so I just wanted to make sure I understood that, because the question is, Delegate Rosenberg, didn't you have something you wanted to add?
Thank you. We have jurisdiction over the advisory board so that we could, with the appropriate legislation, require that certain things be done or prioritized. That is certainly within our power, or ask for an annual report review so that we have some sense of what is being done with this money. That's clearly within our authority.
Can I add something? I didn't see the file folder on who supported and who didn't support. I am surprised that Hopkins is, I don't know if it's enough information. So just a little bit of information, unrelated, but I'm in federal court right now, okay, suing the federal government because they want to reduce the cap on overhead for recipients of federal grants. Our hospitals, and rightfully so, right? When you think about nonprofits and their overhead, what's the number that usually comes to mind, right? It's a nonprofit grant, you can use a little bit for administrative overhead, the rest has to go directly to people. And the number that you probably work with, I know the one that I see is 10 to 15%, right? Okay, if you look at the percentage I'm asking for, it's less than 2%. Why do I mention Hopkins and I'm in court? I'm in court because the federal government wants to cap 15% for overhead for our research institutions. Johns Hopkins percentage overhead is about 60%. And nobody's questioning it or challenging it because it needs to be 60%. They need lab facilities and need this and need that. And if I turned around and I said to Hopkins, well, why do you need a building? Why don't you give the money right to the cancer patients? They'd say, whoa, no. I need the building to do the work, to deliver what I need to deliver. It's the same concept here, right? This is part of the administrative cost of ensuring that the funds that you have are put to good use, and in this case, to make sure that you get more funds. If I was in the Finance Committee, I guess here, if I were in probably Economic Matters on the House side, and because remember, I'm not asking for more money. Right? It's one special fund, another. If I was in Economic Matters, they would be moving favorable on this bill right now. Because they'd say, oh yeah, let's move it out of the Consumer Protection Fund because we got a lot of bills in front of Economic Matters that deal with consumer protection. And I understand, the importance of this fund, this opioid restitution fund. We need to get the money into the communities where it needs. But you need, every fund has some administrative costs and enforcement costs. And that's what we're just asking for that. And again, if I were here back in 2019, I would say, hey, come on, this is what we do for every single inspection, compliance, enforcement program in the state of Maryland. The unemployment insurance fund and the inspections they do around that's funded by the money that employers put into the unemployment insurance fund. I have a home builder registration fund in the Office of the Attorney General. And what do I use that for? To do enforcement actions against home builders. Right, so there's always, I say always, but I would ask someone to find a case in Maryland State where that unit is not funded by the very fund that we established to put the money into. That's all we're asking for.
We do the same thing with the cigarette restitution fund. What pays for that?
The cigarette restitution fund, that obviously comes from the PMs, the primary manufacturers, the participating manufacturers. It's a huge fund. I don't even know that money. I'm not on the appropriation side. And those funds are used for a lot of different reasons. But I have a tobacco enforcement unit within the Office of the Attorney General, and I'd have to check to see whether or not that is funded through the right. I would agree. I would agree. And by the way, that tobacco enforcement unit, again, thank you for the question. That tobacco enforcement unit, I've got 4 people in that unit. John Leovi, you've probably seen him in front of you because you defeated one of his bills last year. And by the way, thank you for treating Patrick Hughes well yesterday. He's one of our lawyers on that Public Information Act bills. Cigarette restitution. And, every year states are arbitrating with the participating manufacturers over amount of money that they put in to escrow. And every state has to prove that they are doing all the necessary compliance work. Whatever that is, don't ask me because I can't explain it. And if you demonstrate it, you get your money back. If you don't demonstrate it, you don't get your money. In Maryland, I have 4 people on payroll, and they have won the last 3 years. And I asked my consumer protection, my tobacco enforcement unit just recently, how many other states do it in-house versus outside counsel? More states use outside counsel, and they're spending millions of dollars. I have 4 people on the state payroll, and so you can imagine that it's less than $1 million I'm spending. And we're winning. Not every state can say we're winning. So this is the difference between and I didn't create it. I didn't create the Office of the Attorney General. I had the blessing of inheriting it 2 years ago, the opportunity. This is what we have built in Maryland. We've built an Office of Attorney General, that tries to do things in-house at value for the people. We only go outside when, we simply have to.
Thank you, Mr. Attorney General. Delegate Hutchinson, did you get your question answered?
The good delegate had the chance to ask a question, so I'm fine.
Oh, okay, thank you. Delegate Szeliga.
Thank you, Madam Chair. Thank you for being here. You mentioned that you're suing the federal government over these indirect costs. You don't think 60% indirect costs is excessive when a lot of nonprofits don't even pay property taxes and other taxes?
That's not the nature of the lawsuit. The nature of the lawsuit is that the process by which the president, NIH, I apologize, by NIH, at the direction of the administration, the process that they're using is unlawful. That's the nature of the complaint.
Okay.
I leave that to others to decide, but I can tell you that historically, these rates are negotiated with NIH, and they take into consideration the shared costs for all the different projects. Imagine if Johns Hopkins or University of Maryland College Park says, hey, we want to do this kind of research, but we can't do it in the parking lot. We have to build a building. Well, I'm not going to be able to get one grant to build the big building, but if I got a bunch of grants to build the building where we can do a lot of that work, I've got to be able to share the cost of that building among these different grants that we get from NIH and other federal sources. So that's why it's high. It's not 60, whatever the percentage is, whether it's 50, 60.
You said 60.
Yeah,
so that I was shocked.
Yeah,
I'm like, 60%, when you're telling
it's not
taxpayers that you are, taking away important grant funding, I think I personally would say we should question 60%. We think that money should go into cancer research, not incidental cost, and there's nothing wrong with auditing it, so.
Oh, absolutely not.
I wouldn't have brought it up, but you did. Thank you.
No, absolutely not. The thing is that you can't do it in the parking lot of Johns Hopkins
Sure,
or
and there's
UMass Baltimore.
plenty of labs available as well, so, you know, we can talk about
Maryland leads the state,
respecting
Maryland
tax
leads the
dollars.
country, it leads the world in research. And we should be proud of that. And it doesn't happen because we do that kind of research in the parking lot.
We are, and America has made a very significant investment in medical research, and we lead the world.
Right.
So nobody's saying that. We're just saying questioning a 60% overhead is probably something that we should do.
Yeah.
Thank you.
All right.
Mr. Attorney General, I'm going to try to be extremely simplistic in my question. If it is more complicated than what I say, you and I have a conversation offline, okay? Am I to understand that up until this point, you have not received you have not been able to receive any administrative costs for the administration of the restitution fund?
That's correct.
Okay, so and what you're asking for is a 2% administrative fee to cover the cost of the department that's doing it.
We don't put it in terms of a percentage, but we put in terms of funding this unit. If you look at the total recovery and what we've spent, it's less than 2%.
Okay, great. Thank you very much.
I don't see any other questions, so I want to thank you. I think you guys, this was like the subcommittee. We're getting into a pattern here. You guys worked out the bill hearing. All right, so thank you for being here. We really appreciate it. We're going to move on to the unfavorable, okay?
Thank you, Madam Chair. Thank you,
So, my pleasure, thank you. So may I have Ensika, and may I have Carrington Anderson, please? And those will be the last two witnesses on this bill. And when you testified, since you're unfavorable, the Attorney General stated that you were working on some amendments. Can you please talk about those amendments, okay? And if that would change your testimony to favorable with amendment instead of unfavorable.
Thank you, Madam Chair. Madam Vice Chair, members of the committee, I'm Ann Seacott, and I'm testifying today on behalf of the Maryland chapter of the National Council on Alcoholism and Drug Dependence. And yes, when I signed up 2 days ago, it was in opposition. We have been talking with the Attorney General and his staff about amendments, and I will address them. At the core, we believe the work of the Attorney General is pretty much an essential and basic function of state government. And I think in an ideal world where we're not dealing with a $3 billion deficit, the general fund would appropriately support the Attorney General's office. We are concerned, as the Attorney General mentioned, that the money has been slow to get out. We're much more confident because the administration of the opioid restitution fund dollars is being moved to a smaller unit, which I think will be able to focus on getting the money out to the community in a more efficient manner, so we're happy about that. But certainly, knowing that the money isn't getting to the community, earmarking money for anything really raises concerns from advocates and community groups. We do understand the logic and the arguments that the Attorney General is making. And certainly if it comes down to not being able to pursue or efficiently pursue the remaining bad actors, we do think that that's a tough thing to stand in the way of. So what we have been in discussions with are a couple of amendments. One is a sunset. We would love to see if this maybe is something that doesn't go on in perpetuity, but an opportunity to revisit, perhaps 4 or 5 years down the road. And then I think along with that, annual report sounds like a very good idea. What are the number of cases being pursued? How many get closed, settled, won, just an accounting, not of the dollars necessarily, but really of the cases themselves. So we think that those might be amendments that we've been discussing, we think we can make happen, and I think that would change our position on the bill. Reluctantly, just because we want as much money going to the community as possible. But we get it.
You wouldn't have the money if they didn't do the work.
Absolutely.
Okay, go ahead.
Thank you, Madam Chair and members of the committee. My name is Carrington Anderson with the Maryland Association of Counties, speaking in opposition, respectful opposition of House Bill 728. I know that the Attorney General just stepped out, but I did just want to thank him and his staff for the incredibly important work they do on behalf of Marylanders who are impacted by the opioid crisis. Our opposition is in no way a reflection of the work that the Attorney General or his staff does. We agree that the Attorney General Enforcement Unit should be fully funded. Our disagreement is over where that money should come from. The ORF is used, or the Opioid Restitution Fund, is used for remediation efforts for some of our most vulnerable. We do need to hold these bad actors responsible, and the Attorney General should have the resources to do just that. I will thank him as well, the Attorney General, for mentioning that sunset. I will say that that does go a long way, and we are very grateful for that. I think in a perfect world, the AG would get his funding through the general fund, and all of the remediation money would go directly to services. So it is for those reasons that we would ask for an unfavorable report on House Bill 728. Thank you.
Again, you wouldn't have the money if they didn't do the work.
To Madam Chair, to Mako, do you have any amendment? What would be the fine balance? So they need the fund as well, and they're not axing everything. They're axing less than 3%. So are you open to that?
Thank you for the question, Delegate. I will say the sunset that the Attorney General's office mentioned, again, that does go a long way. We would have to bring this back to our legislative committee to discuss changing positions or any other amendments. And I will say Sarah Sample in our office is the staff assigned to this bill. I'm filling in for her today, so I will make sure to bring that back to her as well. Thank you for the question.
Seeing none, thank you both for being here with us. We really appreciate it. And thank you for the work you do in the community. It matters, right?
Thank you.
So this actually concludes the bill hearing on House Bill 728. Next, we are going to go to House Bill 720, Delegate Rosenberg. There's only one witness, himself. And then we're going to go to the last bill, which is 386, which has a lot of witnesses. But we're doing great timing. It is 3:23. I want to thank the committee for your thoughtful questions. Go ahead, Delegate Rosenberg. And I forgot, it's just you. I was going to say, do you have a panel?
And it's 7:22, is it not?
Yes.
Yes, 7:22.
Right. Thank you, Madam Chair and members of the committee. House Bill 722 is prompted by coverage of the deplorable care in one facility where people had been referred by the Baltimore City Health Department who have health issues related to opioids. A story that was a joint effort of the Baltimore Banner and the New York Times. And that prompted me, with my Appropriations Committee background, to introduce legislation that says that there has to be a review and an annual report of progress made by the department to improve the quality of care and assess the quality of care that's being provided to people who are, I don't know if it shouldn't be limited to the Opioid Restitution Fund, but certainly that's a place to start. We want to make sure that the money we've talked about for the previous bill is well spent. That was the purpose of that discussion, and this bill is another way to address that by requiring an annual report, putting on the table if the issues in this instance have been addressed at this one facility, and as best we can, preventing that kind of situation from arising else again. The department has met with me earlier this week about the bill and some of the reforms that they're undertaking. And that was a very positive conversation. And perhaps they can have that kind of conversation with the subcommittee, the appropriate subcommittee, in terms of if we want to pursue legislation or in some other way, a letter from the chair, whatever's the committee's view is the best way to do it, so that we address the problems at this one facility and make it very as unlikely as we can that this happens somewhere else. So I would urge a favorable report with that caveat about further discussion with the department. Thank you.
Thank you, Delegate. Are there any questions for the delegate? All right, seeing none, thank you so much, Delegate. This actually concludes the bill hearing on House Bill 722. We are now going to the last bill of the day, but we have a lot of witnesses. We have 5 panels, and that is House Bill 386. And the first panel that I'm going to call is the delegate herself, and Dr. Linda Bourbon, who's virtual. The American Academy of Pediatrics is the person here. Dr. Michael Ishnowski, I hope I pronounced it correctly. We have the chapter of the Maryland AAP, and we have Steve Korseski and Brent Walls from the Upper Potomac Waterkeeper. If you will be so kind and come up. And if you can pull some of the chairs from the front, pull some of the chairs up, yes. Okay, so the primary sponsor again is Linda Bourbon, who's online, the American Academy of Pediatrics, MDAAP, Steve Korseski, and the Upper Potomac Waterkeeper. Good afternoon, Delegate. How are you?
Good afternoon, Madam Chair. I'm doing well. Thank you so much. And for the record, my name is Sheila Ruth, Delegate Sheila Ruth, and I'm here presenting House Bill 386. As this committee well knows, PFAS is a big problem with a lot of potential health impacts. We've addressed some of those in law in previous years. This bill is addressing PFAS in pesticides. I know that this committee had a briefing recently on PFAS and pesticides and got a lot of information, some very deep scientific information about testing, about PFAS in containers. None of that is really relevant to this bill. This bill takes a very simple and elegant approach in that no testing is required. I know that at the briefing you heard that tests did not find PFAS in pesticides. That doesn't mean that PFAS doesn't exist in pesticides. It means that those specific tests that were testing for specific pesticides, specific PFAS in pesticides, did not find them. However, there are PFAS in pesticides, and we know they are because the manufacturers tell us that they're there. Every pesticide has an EPA-regulated label. They are required to list the active ingredients. The active ingredients are those that actually cause the desired effect. There are also inert ingredients which provide other beneficial uses, other beneficial uses to the pesticide. Inert ingredients are a trade secret and don't have to be listed on the label. They do have to be, I believe, submitted with the registration, but we don't have a way of knowing what the inert ingredients are. So when there's testing done, the only way to find out what's in inert ingredients is either to require the manufacturer to disclose it or to test. But we know what the active ingredients are because they are listed on the label. And some of the active ingredients listed on the labels in PFAS that are registered in, on pesticides registered in Maryland are PFAS according to the chemical definition of PFAS. And so there are 66 chemicals that have the structure of PFAS. under this definition, and those 66 chemicals appear in a little over 1,000 registered pesticides in Maryland. Again, we know that these chemicals are in there because they're listed on the label. The manufacturer tells us that. So this bill takes the very simple approach that says, if this pesticide, the manufacturer tells us that PFAS is the main ingredient in it, we need to start phasing that chemical, that pesticide out, because we know the harms that PFAS cause. And so the bill takes an approach of phasing it out first with our most vulnerable people. It phases it out in schools, daycare centers, hospitals, residential lawn care, and mosquito spraying. And so, and we intentionally give commercial operations and agriculture much longer to phase it out. So we want to get it out of our schools so it's not affecting our children. We want to get out of hospitals where there are sick people. And so those are the first ones that we're looking at by 2026. By 2027, the bill says that the Department of Agriculture should no longer register those pesticides, and then it gives until June 2028 to use up the rest of the stock for other uses besides those that were initially said. One other thing that I think gets a little confusing is when we say PFAS, it can mean different things depending on how we're using it. Sometimes people use PFAS, and some of the things that we say are PFAS, we're only looking at those first two that were discovered, PFOS and PFOA. Sometimes it's used to mean a larger group that have also been extensively tested, and sometimes it's used to mean the whole class. So we always need to be aware when we're talking about PFAS, are we talking about a small group, a large group, and so this bill really looks at the whole class, and you'll hear from some experts of why it's important to start phasing out the whole class, not just those couple that have been extensively tested. I've heard farmers say, why are you targeting agriculture? We are not targeting agriculture. In fact, we are first, as I said, phasing it out of some of these other uses that are very important. Agriculture happens to be one of the uses. We don't want to take a tool out of the toolbox of agriculture. We understand the concern, so we give them more time to find alternatives, and there are alternatives. There are 14,000 pesticides registered in Maryland. Of those 14,000, only a little over 1,000 are PFAS. And there is a handout in your bill file which looks at some of the substitutes that are available. Another thing that you will hear people talk about is that EPA has a roadmap. EPA no longer has a roadmap. EPA did have a roadmap. It was called the EPA PFAS Roadmap 2021 to 2024. It's no longer 2024. So that roadmap ended. And in November of 2024, the EPA put out their final report on their roadmap. Maybe this new administration will have a new roadmap. Maybe they won't. There's a lot of uncertainty right now coming out of Washington, and we really just don't know what they will do. But we do know that in the first days of this new administration, they withdrew a draft rule that the previous administration had been working on that would put limits on industrial wastewater. So that has already been withdrawn by the new administration. So we don't know what's coming out of Washington. We can't count on Washington, and it's up to us to protect Maryland, and we need to protect Maryland. So in Maryland, we're taking a very targeted approach to PFAS. There are some other states that have done blanket bans. Minnesota and Maine have both banned PFAS in everything with a phased-in approach. In Maryland, we've been very careful and very cautious to look at what the real problems are and how to address them. We've prohibited PFAS in firefighting foam, in food packaging, rugs and carpets, and some playground surfaces, and we're looking at some other things. We have not done this blanket ban. We're taking a very careful phased-in approach, and this is in line with that phased-in approach. And so last thing I want to say is we did meet with members of the agricultural community and have discussions, met with Lindsay Thompson and Tyler Huff, and we really tried to work out the differences. Unfortunately, there are two main areas that are red lines for them that we just could not find a compromise. And I do believe they bargained in good faith, and we tried to find a common ground, but we could not. And those two areas are, one, they believe that the EPA should be regulating this and we should follow the EPA. The EPA has been slow in any case at moving. They have been moving over the last couple years, but they've been slow. But now, as I said, we don't know what Washington is going to do, and so we can't count on Washington. The second thing at issue is the definition. The definition that we use in this bill is the most widely used definition. It's used in 22 states, 22 other states, including Minnesota and Maine, which I mentioned have banned all PFAS with some exceptions. It's also used, the OECD, Organization for Economic, I can't remember what that stands for, I apologize, but they use this definition. In fact, there is a scientific paper that you can look up that explains why they came to this definition. And you will also hear from experts about why this definition is important to use. It is also the definition that is in Maryland state law. So we have already passed this definition in Maryland state law, and it's the definition we are using for other things as well. We did offer this phased-in approach as a compromise. I hope to try to make things a little easier for the agriculture and commercial communities that are concerned, to give them more time to phase it out, but that didn't seem to be sufficient to address their concerns. So I'm always open to continue talking, and but so far our talks have not been productive. And with that, I would like to turn it over to my panel, and thank you so much, Madam Chair. I ask for a favorable report.
Thank you. Who will be next? And you will have 2 minutes to provide your testimony. The alarm goes off, and if it does, will you please just wrap it up gently? Who would like to go first? How about
I think I go first. I'm Linda Birnbaum, a toxicologist, microbiologist, and environmental health scientist, and the former director of the National Institute of Environmental Health Sciences, as well as the National Toxicology Program. I worked for the EPA for 19 years prior to my work at NIEHS. I've been sounding the alarm on PFAS and addressing their serious health effects. Of great concern is that commercial PFAS break down into other PFAS, which are often more toxic and persistent than the original PFAS that were intentionally produced. But all fall under the widely accepted OECD definition of PFAS, which is considered the scientific definition accepted by 37 nations, including the US. There's sufficient evidence that PFAS cause multiple health problems, as you are aware. For instance, immune system damage, kidney cancer, and elevated cholesterol in humans. The data are very strong. And I want to be clear that we have studied PFAS enough to know that they all persist and have similar toxicological effects. High persistence, mobility, accumulation, and hazards of PFAS studied to date warrant treating PFAS as a single class. It is not necessary to study all 15,000 PFAS in order to act. PFAS cause harm to so many systems within our bodies. They're readily absorbed through skin, creating a dangerous occupational hazard for farmers and farm workers exposed to PFAS pesticides used in the fields, in the air, and when produce is handled. All PFAS pesticides cannot be removed from our drinking water or our soil with currently available remediation technology. We need to eliminate this available source of PFAS from pesticides. We cannot rely on US EPA to adequately address PFAS protections. States need to protect their residents. I urge this committee to take a crucial, simple step in protecting Marylanders by passing HB 386. Thank you.
Thank you for being with us. Next, please.
Yes. I'm Dr. Michael Ikniowski, and I'm representing the Maryland chapter of the American Academy of Pediatrics. I'd like to share my concerns about PFAS pesticides, Those are the pesticides that are, by definition themselves, PFAS chemicals, particularly in relation to children's health. The health hazards and persistence of PFAS are well known to those who have served on this committee, but it's important to mention the specific adverse effects of the PFAS pesticides that are the subject of this bill. Studies have identified increased risks of cancer, birth defects, immune suppression, thyroid disease, endocrine disruption, neurotoxicity, and kidney and liver toxicity, specifically from PFAS pesticides. My written testimony lists these specific pesticides associated with each of these categories. Most of these studies were conducted in the years and decades after these pesticides were registered by the EPA. So this is information that's come to light since they were registered. Because children eat and drink more for their size and breathe more rapidly than adults, they are more susceptible to toxic effects from hazardous substances. They are uniquely susceptible to toxic exposures that affect their growth and development. It's not the dose that determines toxicity, it's the vulnerability of the exposed person. A fetus is also highly vulnerable, particularly during the first trimester when every organ system forms and develops. PFAS have been shown to cross the placenta and enter the fetal circulation. Exposures during this critical time of brain development and organ growth have the potential for substantial and long-lasting effects. Because PFAS persist in the environment and because they are poorly excreted, the potential for lifetime exposure and accumulation in children is substantial. Eliminating PFAS pesticides, which are used in schools, on athletic fields, and in communities, would help in reducing children's total body burden of PFAS. We need to prevent further contamination of the soil and water used to grow our food. We need to stop adding more and more of these persistent and harmful chemicals to our environment and exposing our children to them. House Bill 386 would help to achieve this. Maryland AAP requests a favorable report on this bill. Thank you for your time.
Thank you, Madam Chairman. My name is Brett Walls. I'm the Upper Potomac River Keeper, and I've been studying this issue for about 6 years now. I've sampled wastewater treatment plants, I've sampled biosolids, farm soils, runoff from farm soils, rivers and streams across Maryland and some of the surrounding states. So I know that PFAS you can find it everywhere. In 2022, I worked with river keepers in 34 different states throughout the United States to test rivers and streams, and we found PFAS in every single sample. 83% of those samples had significantly high levels of PFAS in the river system, and many of those were in rural locations. Pesticides with an active ingredient of PFAS is a significant source of PFAS that is impacting our rivers and streams right here in Maryland. And it's coming from stormwater from our farm fields and from our rural areas. In 2023, MDE recognized that PFAS is such an issue that it issued fish consumption advisories for several different fish species in the state, across the state. All these locations, which were probably about, I think, 20 to 25 of these locations, are in areas where communities are really there fishing for sustenance. It's one of their only methods. Last year, Vicki Blazer, U.S. Fisheries biologist, released a report that basically says that one of the significant sources of PFAS in our rivers and streams and in our fish species are coming from pesticides with PFAS. And in fact, the same pesticides that we're wanting to eliminate here in Maryland were found in the river system where those fish were tested for PFAS. So HB 386 is a very, very simple step to take to eliminate one significant source of PFAS in the state of Maryland. Thank you.
Thank you. Thank you, Madam Chair, members of this committee. I'm Stephen Krzyzewski, a husband, a father, and a co-owner of a fifth-generation family farm, Mason Farms Produce and Mason's Heritage in Queen Anne's County. We farm 900 acres growing corn, soybeans, and small grains like most Eastern Shore producers. After years spent transitioning conventional acres to certified organic crops, we have proven we can successfully farm without PFAS pesticides in our toolkit. Farmers, and in fact all Marylanders, deserve a healthy PFAS-free food supply. While all farmers are at serious risk from persistent PFAS contamination from neighboring pesticide drift, runoff, or prior use, organic farmers have an added concern. They could lose their organic status if PFAS chemicals are found on their farm. Not only is this an issue for our crops, but for another critical Maryland industry, seafood. As already mentioned, MDE is already issuing PFAS advisories for many fish species, including smallmouth bass. Will Maryland's blue crab be next on this list? My experience in both conventional and organic farming is that there is simply no need to use any of the roughly 1,000 PFAS pesticides registered in our state. There are truly hundreds of other alternative Maryland-registered pesticides in farmers' toolkits that don't contain PFAS chemicals as their active ingredients. All the agricultural products grown in Maryland can be grown without PFAS, as many of us are doing now. Mason Farms Produce and Mason's Heritage asked for a favorable report on HB 386 for the sake of our farm families and all Marylanders who depend on us for their food, as well as for the future of Maryland farming. Thank you.
Thank you for being here. I really appreciate it. We're now going to open it up for questions. I see first Delegate Hutchinson, then followed by Delegate Chisholm, then Delegate Kaiser. And Delegate Collison will take over for me for a few minutes. Just want to say hi to a friend who runs healthcare for the homeless and does an excellent job. I'll meet you in the committee. Go ahead.
Thank you, Madam Chair, Madam Vice Chair. Thank you, Delegate, and I ask for your indulgence because I do have a Dr. Hill-style question here. Delegate, thank you for bringing the bill. I know this is deeply rooted in you, and you're very passionate about it, and I greatly respect that. As you said, you know that this has a major impact on our largest industry in the state, and that's agriculture. And for me, from the Eastern Shore, I have great concern about what impact it could have on our poultry industry. But we're here in HGO today, so let me take a little bit of a different approach. I read some of the statements that we've received in testimony, and I'd just like to point out the Maryland Pest Control said this bill would eliminate the access to critical federal and state registered pesticides used to manage bed bugs, cockroaches, mosquitoes, rodents, termites, and other pests. They go on and say that these are used in workplaces, an OSHA standard to prevent pest infestations in workplaces. It prevents food contamination in processing plants, and it helps to make sure that we're meeting local sanitary regulations. The Animal Health Institute says they're used for the prevention and treatment of external pesticides, fleas and ticks and mites that can seriously harm animal health and welfare, but these parasites can also infect humans as well. So since we're in HGO, I somewhat see this as it could create unintended consequences in terms of a public health crisis as well. And I'm on the public health subcommittee, so that's certainly near and dear to me. So passage of this bill, we could have uncontrolled cockroaches in our homes and schools, widespread mice in our restaurants and kitchens, rats rampant throughout Baltimore, more outbreaks of avian flu in the poultry industry, increased incidence of Lyme disease from tick bites, West Nile virus and encephalitis from mosquito bites, and so on. Now, I originally was going to ask you, because we're in HGO, we are the Committee of Compromise. But I understand you tried compromising. I was going to ask you about if you would compromise to accept the EPA standards, and you were very emphatic about where you stand on the EPA standards. But you also mentioned that Minnesota and Maine have introduced bans. But if I understand it correctly in my research with Minnesota, they've eliminated 11 products today, but a full ban doesn't go into effect until 2035. So they've only taken a small handful of the PFAS chemicals. Have they been able to determine, will they be able to control the pests and the rodents and the insects that I mentioned here in my initial introduction here?
Thank you for the question, Delegate, and wow, that was a scary list. I can assure you that those scary things will not happen because there are some 13,000 other pesticides that can be used and were used before PFAS started being used in pesticides. So there are plenty of alternatives. There is a list in your bill folder of alternative pesticides that can be used. Out of 14,000, this would only eliminate a little over 1,000 of them. In terms of, I just want to say that we are not rejecting the EPA definition, that EPA uses different definitions depending on the situation. And so it's a little bit more complicated when you're talking about EPA. And so that's situational when we're talking about the EPA, but the broader definition is the definition. If there are specific things that we need to look at that are going to cause harm, certainly open to discussing whether, any specific chemicals need to be exempted or if there are any specific things we need to be looking at. But I don't believe we need to make broad-based exemptions.
So my follow-up on that then is, because the other states I said was 2035 for a complete ban, you're looking for 2028, which is right around the corner. Why so soon?
I think Minnesota is actually 2032 is the final number, but there are some phase-in points up to 2032. So that's only 4 years beyond what we're asking for. And I don't remember, I would have to look what the phase-in points are before that. But again, certainly if the date is the only issue and we need to add a year or two to that, certainly open to talking about that to try to give more time to transition. We need to, the sooner we can stop putting these into our environment, the better we will be, because right now they're adding to the cumulative amount of PFAS that is going into our environment and our bloodstream.
Thank you. Somewhere in there I heard the word compromise. Thank you. Appreciate that. Thank you.
Thank you, Delegate. Delegate Kaiser. Her list, you're deferring to Delegate Chisholm? We will go with it.
And Delegate Kaiser. I wasn't going to ask this, so it's going to be a Terry Hill question. But since you just brought it up, I am curious on, you talked about alternatives. Why are the alternatives not being picked up more quickly? In that, is it a supply chain problem? Is it a effectiveness problem? Is it a cost problem? And then, secondly, two parts. One of the things I find fascinating is that we also find a good deal of PFAS in wind turbines, electric vehicles, solar panels, heat pumps. If we're going to start to eliminate all this, how do we square that with those products as well?
Madam Chair, since he asked two questions, could we have one person answer one? And
That's exactly where my head went, Delegate. This is going to be two different people, each answering one question.
Thank you so much. You want to take the first one?
Thank you, Delegate. I appreciate it. That's a great question. Now, I can't really speak for the industry themselves, but what I can speak is knowing the chemical itself. Knowing the chemical itself is extremely important because the part about PFAS is that it's waterproof. And you think about a pesticide being waterproof, you can spray it on the plants and spray it in the area, and it's going to stay there a whole lot longer. It's going to weather the events, and it's going to be more active. It's going to be more persistent to get rid of those pests. And so my understanding, thinking this through, is that it's likely to want to go with that kind of a pesticide because it's going to stay there longer. It's going to resist the weather. It's going to be a little bit less expensive because you're not going to be using as much. So that's kind of my rationale. I mean, the industry might have another answer.
Okay, so it'd be more expensive. Theoretically, based on your rationale, it's probably more expensive or not as long effectiveness.
The effectiveness, I think, is it. So,
okay.
Yeah. And when it comes to the other, I'm sorry.
That's okay. Thank you so much. And so in terms of your question about wind turbines and other things, we need to move away from PFAS in everything. And I personally just replaced all my cookware to make sure I have PFAS-free cookware. But I know it's overwhelming when you hear, like you heard at the recent briefing, about so much PFAS already being in the environment. And we want to get rid of it all at once. But the more we can reduce the load going into the environment and the load going into our bodies, the better off we will be. So trying to take a comprehensive approach like Minnesota did and ban it in everything. There's a lot of temptation to do that, but it would be difficult and require a lot of implementation. Instead, we in Maryland have taken the approach that we look at each of these categories. Firefighting foam was one of the worst, and we banned it in firefighting foam. Plastic food packaging, because we don't want PFAS coming into contact with our food that we're going to put in our mouth. So these are things we've already done, and we are looking now at pesticides. And again, this bill only gets at active ingredients in the pesticides. There could be other inert ingredients that we don't know about. But the more we can reduce those and eliminate ones that are going into the environment, the better off we will be in the long run. And so we, as I said in my initial testimony, we take a measured approach, and we're trying to really just take step by step to get these things out of our environment.
So as long as you and I are both here together, I should assume you're going to continue to bring PFAS products bills based on what you said, and which I appreciate. If you want to slowly do it, then.
So thank you for the question, Delegate. And just to be clear, it's not just me. It's many people in Maryland. The other bills I mentioned were other legislators. And so when I said we, I meant we, the General Assembly, not we, me, and.
I appreciate it.
Thank you.
I was in ENT today, so I feel like it's like my environmental day. Thank you, Madam Chair.
Thank you, Delegate. Sometimes these bills take time. Delegate Kaiser.
Thank you, Madam Chair. My question was just super basic. I walked in, though I was listening from the committee room. What I didn't hear, Delegate Ruth, at the beginning of your testimony, maybe you said it, was this bill any different from last year's submission, and what were those significant changes?
Yes, thank you so much for the question. And the biggest thing that we did this year is we tried to phase it in to allow the agriculture and commercial industries more time to get rid of this. Thank you.
Thank you.
Thank you. Delegate Bagno.
Thank you, Madam Chair, and thank you for bringing this. And I'm going to dovetail off of my good colleague from the Eastern Shore as the Chair of Public Health, and just ask if you could reach out to the Department of Health. I noticed that they hadn't weighed in, though you have a number of different health professionals, and ask if you can get a consult between the Department of Health and Department of Agriculture to confirm that we have existing pesticides that would alleviate the concerns of broad scale adverse health outcomes.
Thank you so much for that question. And I also wanted to mention that one of my experts told me that none of the PFAS pesticides are rodenticides. So that wouldn't, the scary part about rats wouldn't apply here. But I will definitely reach out to the Department of Health and Department of Agriculture and try to make sure that we aren't going to cause any public health emergencies.
Thank you, Delegate. Any other questions? Delegate Chisholm, you've got your pen up. You sure? Okay, you're good. Delegate Taveras.
Thank you, Madam Chair. So as you know, this is, hold on, let me put on my glasses. Okay. So, you know, as someone who understands the importance of this issue and trying to avoid the bioaccumulation and the persistence of this, of these chemicals, we also have to recognize the industry concerns that that they're more effective, or so they say, on the spotted lanternfly program here in the state. That's one of the unfavorables letters, and that in another letter, it says that there are currently no alternatives available for animal health products. Are you, in this letter, I believe it's from the Animal Health Institute, how are you responding to those concerns, or looking to respond to those concerns?
Thank you for the question, Delegate. And I believe what the Animal Health Institute is, and just to be clear, I believe they represent manufacturers. I believe what they're talking about is flea collars. And frankly, we certainly want to be able to protect pets, but do you really want PFAS in a collar around your cat's neck where it's going to be absorbed into the cat's skin? There are other products that do not contain PFAS that can protect your pet. Before PFAS was around, we had flea and tick products as well. So certainly would be glad to talk to them and see, what if there is a way around it. But we have to balance protecting our pets from fleas and ticks and protecting them from PFAS too.
Thank you.
Thank you.
Okay. Seeing no other lights, that completes this panel. I'm going to go to a second panel of favorables, and then we will switch to unfavorable after this next panel. So if Dr. Anna Rule, Dr. Caitlin Saris, Sean Lynch, and Dr. Alexis Temkin can come up. So please remember to bring the mic as close to you as you can. And whomever would like to start, go ahead.
Sure. Thank you very much. Good afternoon. My name is Anna Rule, and I am assistant professor at the Johns Hopkins Bloomberg School of Public Health. The opinions here are my own. I am the principal investigator of a recent pilot study in which PFAS were found in every one of the Maryland residents that we tested. 4 of 41 people, in 4 of 41 people, the concentration of PFAS was higher than the maximum recommended level by the National Academy of Sciences of 20 nanograms per milliliter. As you know, those levels are sufficient evidence of several concerning health effects, including increased risk of kidney cancer and high cholesterol, decreased infant and fetal growth, and decreased antibody response in both adults and children. Out of our 41 participants, 85% have PFAS levels in their blood between 2 and 20 nanograms, which trigger special screenings by clinicians, including for breast, liver, and testicular cancer. Recent studies have extrapolated healthcare costs for the United States from PFAS pollution and disease at up to $62 billion annually. Maryland's portion, based on 2020 census data, is estimated between $689 million and $1.1 billion annually. As an example, the pesticide bifenthrin is a PFAS often used in healthcare facilities, home, lawn care, and agriculture, and it's also used for mosquito control. Bifenthrin is an endocrine disruptor linked to autism, Alzheimer's, and Parkinson's disease. Because it is also a PFAS, it is highly persistent in the environment, with the longest known residual time in soil of insecticides currently on the market. There is little research on the effects of exposure, but bifenthrin is just one of thousands of PFAS pesticides products allowed in Maryland. I do worry that we are one large human and environmental experiment with health consequences that are expected to impact generations to come. I urge you to please give HB 386 a favorable vote. Thank you for your consideration.
Thank you. Next, please.
Thank you. My name is Caitlin Series, and I'm a registered nurse and an assistant professor at Towson University in the College of Health Professions. As a nurse, a public health practitioner and researcher, and expecting mother, I am deeply concerned about the impacts of PFAS pesticides on pregnant women, the developing fetus, and children. I am also a member of Dr. Rule's study team. Our study includes 6 women and 3 men of childbearing age. All of these participants had high levels of PFAS in their blood that are above the National Academy of Sciences levels of clinical concern, and several were much higher. 3 of these participants reported reproductive health challenges, all of whom had 4 to 5 different PFAS compounds present in their blood. PFAS pesticides represent a significant exposure pathway for pregnant individuals, the developing fetus, and for children. Studies show that maternal PFAS exposure can increase risks of miscarriage and preterm birth. PFAS also cross the placental barrier, impacting fetal thyroid levels, which are crucial for healthy development. The effects of in utero PFAS exposure persist into childhood. Higher maternal blood PFAS concentrations during pregnancy are linked to poor immune functioning, increased susceptibility to infections, and lowered vaccine responses in children. PFAS exposures also reduce fertility in both men and women. In women, the likelihood of experiencing pregnancy and live birth decreased by as much as 40% in women with high PFAS exposures when compared to those with lower blood levels. In men, PFAS exposures are correlated with elevated risk of testicular cancer and decreased sperm quality. By passing HB 386, you would protect pregnant people, their infants, and their children, and couples trying to conceive. I urge you for a favorable report on this bill. Thank you.
Next, please.
Good afternoon to the committee. My name is Dr. Alexis Temkin, and I'm a senior toxicologist at the Environmental Working Group, which is a research and policy organization based in DC with extensive experience researching the effects of PFAS and pesticide exposure on human health. Well-studied chemicals in the PFAS class are known to be extremely toxic to human health, and the effects of these well-studied compounds raise serious red flags about the health impacts of all members of the PFAS class, including the PFAS active ingredients, or PFAS pesticides. This is especially true for immunotoxicity and developmental and reproductive toxicity, where harm has been shown at low levels. The opposition will tell you that the Environmental Protection Agency has it covered when it comes to regulating these chemicals. However, according to analysis from the EPA, about 35 of the PFAS pesticides, do not have an updated developmental and reproductive toxicity study, and about 40% of the pesticides that show immunotoxicity were PFAS pesticides, which is a higher percentage than those that make up the overall pesticide use. PFAS pesticides are also widely detected in food products, which can put our food supply at risk and be a common route of exposure for the general population. About half of the registered PFAS active ingredients have been detected in produce sampled by the USDA, even after that produce is washed. And about 9 types of fruits and vegetables, which are also grown in Maryland, had detections of 5 or more different PFAS active ingredients, which raises concerns about how these chemicals can interact with one another. I'll close by mentioning that PFAS pesticides are also a likely source of PFAS breakdown products in the environment, which can persist for decades and generations. Studies have shown that these levels of short-chain PFAS detected in water are often much higher in agricultural areas than in non-ag areas. So I'll urge you to pass this bill and protect Marylanders from PFAS exposure. Thank you.
Thank you. Good afternoon, Vice Chair and members of the committee. My name is Sean Lynch, and I'm the project director for the Maryland Pesticide Education Network's Integrated Pest Management, or IPM, in Healthcare Facilities project. Our project assists Maryland healthcare facilities reduce pesticide use around vulnerable healthcare populations. And our project reviews healthcare facilities' pesticide vendor books, log books, and we have seen some of the very PFAS pesticides addressed by HB 386, including fipronil, bifenthrin, and indoxacarb being used at our healthcare facilities. These pesticides carry the significant added health risk of being a PFAS, or a forever chemical, with potentially serious health impacts. And this becomes a significant issue because, as you are probably familiar with some of these numbers, these PFAS pesticides are used not only in Maryland's over 100 hospitals, but also at our 1,640 schools and our 230 nursing homes. And they're also used in daycares, and these are actually all the first locations that this bill would protect. You have the power to protect the most vulnerable among us, elderly, infants, young children, and pregnant mothers. So when they are in a healthcare facility, all precautions are taken to minimize exposures to unnecessary PFAS. As you know, PFAS have significant health impacts. And in fact, I recently had my own PFAS levels tested, and I was alarmed, although not surprised, to learn that my PFAS levels are at a range where there is a potential for health impact. And I largely do what I can to avoid PFAS already. And one of the things I did want to address, one of the questions earlier, since from my role in IPM and Healthcare Facilities Project, we actually are aware that there are alternatives for bed bugs. So I just kind of wanted to address that. And in fact, one of the methods, because we've awarded some healthcare facilities for being pesticide-free, don't even use a pesticide for it. So I please act now and ask for a favorable report on HB 386. Thank you.
So I see Delegate Hutchinson.
Thank you, Madam Vice Chair. My question is for Ms. Ruhl. Your study sounds fascinating that you worked on. And is the PFAS that was in the study, the PFAS that we're talking about here in the pesticides that we're concerned about, or are they other forms of PFAS such as PFOA or PFOS?
Before conducting the study, I asked many of the labs that I know if they would test for the specific PFAS that we're talking about. But as far as I could find, no lab would test in the blood for the same PFAS that are in the pesticides. So what we decided to do is go with a known and validated study that tests for 45 PFAS in the blood that belong to that broad chemical. So PFOA and PFOS are two of them, and 42 other PFAS. So to answer your question, they're not the specific PFAS because nobody tests for those in the blood, but they are part of the PFAS family that we're still concerned.
Thank you. Just so I understand you completely, so the PFAS we're talking about, the pesticides, you were not able to detect in the blood?
No, that's not what I said. We were not able to find a laboratory that could test for them. We don't know if they're in the blood, but we cannot test for them. There's no known method for detecting these PFAS in the blood.
So you can't prove that they're in the blood either?
Yeah, we cannot prove either one way or another. But by finding all the other PFAS, we are raising a concern that there's a possibility that these other PFAS are also there.
Great. Thank you. Appreciate your time.
Delegate Warman, it's your first question in the committee.
Thank you. I think this question is for the Dr. Temkin. You said that PFAS has been detected in food. Which foods and who detected it?
Yeah, so for pesticide testing in food, the U.S. Department of Agriculture runs a big project every year where they collect hundreds of different samples of different fruits and vegetables from different states, including Maryland. And they test them for a suite of pesticides, about 400 or 500, and that includes the PFAS pesticides that we're talking about today. And so 33 of those were found in foods, and some of the food types that had the most PFAS pesticides found in them were really healthy, wonderful items like kale, grapes, sweet bell peppers, hot peppers, mustard greens, peaches, strawberries, and tomatoes. So amongst other, there were 39 different fruits and vegetables that had detections of some of these pesticides.
Great question. Short and sweet. No, don't learn bad habits from some of us, okay? Okay, any other questions? All right, seeing none. Thank you so much for being here. Really appreciate it. I want to call one last favorable, and then I'm going to call all the unfavorable. Rachel Jones, do you want to come up? Department of Agriculture. You have to wait a while, but I'm trying to get you out of here before 4:30. How's that?
Thank you, Madam Chair.
You're welcome.
Madam Vice Chair, members of the committee. So it's actually a letter of information, but from the Maryland Department of Agriculture, Rachel Jones, Director of Government Relations. We appreciate the bill sponsor and her intent and her willingness to, throughout the past couple of sessions, talk with the department about concerns that the agency had. And so today, we just want to provide information to the committee. I know that we gave a briefing to the Public Health and Minority Disparity Committee a couple of weeks ago on the PFAS report that was a result of the work group that MDA, MDH, and MDE participated in 2023. We spent time looking at both health impacts and environmental impacts, and we coordinated with the EPA. They did have a couple of staff that joined us for a few of those work group meetings, and so I know that there are a lot of things being discussed, like the definition and all of that. Today, we just want to talk about the impact that it's going to have directly on products that we know are registered with our state chemist at the Maryland Department of Agriculture that are used currently in the state of Maryland. And so we've heard testimony about the different type PFAS, PFOA. We know that it's found across a variety of items from food to in the environment or what have you. But the pesticides that are tested and registered in the state of Maryland have gone through some testing, and many of them have not been found to contain PFAS. However, we know that not every single pesticide has been tested, and so that's already been said. We want to state that. And so we use pesticides for a variety of things here in the state of Maryland, and it's not just farmers, it's not just pest control companies, but it is the agency ourselves. We spray for mosquito control, for pest control. In 2023, we had an outbreak of both malaria and Ebola in the state during the MACO conference over the summer, and we were not allowed to disclose what parts of the state that those outbreaks were in, but our teams did have to get to work to very actively begin spraying for public health reasons to keep those concerns, to keep any spread of those conditions from happening. And so we use those pesticide products for weeds, mosquitoes, spotted lanternfly treatment, rodents, and other pests. There are currently 1,063 pesticide products that would be impacted by this legislation. And those products would affect people across a wide range of industries, as it's already been discussed, from homeowners to pet owners, farms, lawn and landscaping professionals, and pest management. So I want to give a quick breakdown of what those things would be. 73 of those products are rodenticides, 653 are insecticides. 205 of those insecticides contain one main ingredient, bifrenthrin, that's used for mosquito control and flea and tick treatment. There are 261 herbicides and 76 fungicides. And
It's okay. You could go ahead and finish it.
Thank you, Madam
You're
Chair.
the only info, which is rare for us to have an info. Go ahead.
So these different categories are used for a variety of things. And they're used for control of different weeds that farmers and landscape companies may use, so bull thistle, Canada thistle, Johnson grass. These things can often cause issues in disturbed areas such as forest clear cuts, riparian areas, and pastures. Some of these can be very invasive and can help not help, but can cause crop destruction and reduce crop yields by competing for light and moisture and other elements. And so we just wanted to share today that those are some of the things that the department has observed, right, that these are the products, these are the uses for them. However, we do know, as it's already been stated, that there are 13,000 other products that are registered. We don't know yet, and we can try to get a breakdown if the committee has questions about that, how many of those alternatives are as popular or are as effective as the 1,063 that may be impacted. We do want to state that over time, the diversity in the market of products that are used help to increase the effectiveness. And so we are trying to collect information to get back to you all about the effectiveness of the 13,000 or so products that would remain on the market based on questions that I've heard already today. And with that, we appreciate your consideration of this information.
Thank you. Are there any questions on this information? Delegate Hutchinson, followed by Bagnell, followed by Collison.
Thank you, Madam Chair. Thanks for the information. I don't know if you have the answer to this, but I appreciate you were saying that you'd get it back the information about the other 13,000 chemicals or options that are there. But has the state also done some testing on the number of applications that are needed? Are there going to be unintended consequences with these other unknown or less used products that have to be over-applied or applied multiple times? And does that create unintended consequences because we're applying a chemical too much?
There is potential that alternative products that folks may use to try to figure out if they're as effective, there is potential that some of those products may have to be applied more times in order for it to be as effective, but only time will tell that. Again, we know there are other products that can potentially be used. We don't know yet how many of those farmers are already using or landscape companies are already using. And so that's data we would have to try to collect and try to figure out what the majority of both commercial and agricultural industry folks are using in the state. But that is a potential risk, is that if during the 3-year phase-out period or 2.5-year phase-out between now and July 1 of 2028, we appreciate the sponsor's consideration in trying to make sure that there was time for business owners to utilize what they may have already had in stock over this next couple of years. But not only do they have to use what they have in stock, but then they've got to try to find effective alternatives in that same time period. And so the answer is potentially yes, but I don't have a definitive answer at this time.
Thank you. Appreciate you being here.
You're welcome.
Delegate Bagnell, Collison, Hill.
Thank you very much, Madam Chair, and Delegate Hutchinson and I seem to be sharing a brain today. So it's not in the bill, but do you feel that the Department of Agriculture might have capacity to do a report as we roll this out on any unintended consequences on the availability of alternatives, and would you be amenable to us considering that?
Sure, yes, that's something that we can do. What is in the bill is a requirement for MDA to publish a registry on the website of the products, I believe that would be banned. And so, as part of our fiscal note, we did say we'd need one additional staff person for that. And so certainly working on that report and the data, that's something that could be rolled into this and something that we could do.
Thank you. Thank you very much, Madam Chair.
Delegate Collison.
Thank you, Madam Chair. And thank you for this information. You spoke about getting back to us on the efficacy of the alternatives. Has that work already begun, or are you just now going to, you and probably other entities across the country are working on?
Certainly. I made note of it during the earlier testimonies as something that I thought could be a potential question. And so I've already reached out to our team and said, please start trying to get us some information on the alternative products. We know what's registered, but we don't necessarily know. They're registered. You have to register any pesticide product in order to be able to sell it in a store here in Maryland. But we don't have record of like how many Ace Hardware and Lowe's and Home Depot, Walmart. We don't know how many products they sell in a year. And so we wouldn't necessarily know right away how effective they are, but we could collect scientific data about the effectiveness of some products over others.
Great, thank you.
You're welcome.
Delegate Hill.
Thank you. I don't know if you're able to answer this today. If not, if you could get back to the committee. You talked about the transition, using up what's on the shelves and then finding something else. If those dates were pushed out an additional 2 years or 5 years, would that make it easier, not change anything in terms of how the department feels about it? And the other thing is that the bill talks about, talking to some of the opposition earlier today, talks about 1 carbon PFAS as opposed to 2 carbon, and apparently 2 carbon is the federal definition. We use 1 carbon in the state, so I'm not sure why we would want 2 different ones, but would that change anything significantly if we were talking about we phase out 2 carbon PFAS? And if we take 5 years instead of 3 years before people, could you just get back to us whether you think that would make any difference?
Sure, I can
tell
kind of
something?
tell you.
Okay.
The administration and the Department of Agriculture have no intent to dispute the definition. While we, as an agency, we do go by the two carbon definition. We do go by what the EPA goes by because we are a state agency, and so we get guidance from federal government agencies, and so we do go by that throughout our processes and our analyses of various products, and that's the definition that we use internally as an agency. We aren't looking to necessarily dispute that with the sponsor, but I do believe that might mitigate some of the concerns the industry has. But as an agency, that's not something that we were looking to dispute. And I'm sorry, what was your other question?
The other one was the phase-out period. You appreciated that the sponsor was offering it,
yes,
but it still didn't seem to take into account enough of what the people using it would have to do. So the question was, if it were extended another 2 years or 3 years for a phase-out, would that make a significant difference to the position or what you have to say?
Now, that part, I do think that the MDA would agree would make a bit of a difference because, again, it's not only, so the way the bill is written, the sale of products would be banned after January 1, 2026. But those who already have it in stock, commercial business owners and farmers who may already have some in stock, that was the consideration that the sponsor put into the bill, is if you have it in stock, you have until 2028 to finish using it. And so, but again, if you take 2 summers, if you stock up and buy it and you're a farmer and you've got a large acreage of land or a large commercial landscaping business and you have 2 years of it in stock already, then you still need time to find an alternative that works as effective for either your farm operation or your customers or for mosquito control or for, rodent control. And so certainly I think having an effective date that was phased out a little bit further would give adequate time to make sure that the alternatives are as effective.
Thank you. Thank you, Madam Chair.
All right, any other questions? All right, seeing none, let's go now to a panel of unfavorable. So we started with favorable, info, now unfavorable. We have Linda Thompson, Charles Barton. Will you be so kind and pull up some chairs? Tyler Ha, Karen Reardon, and Manojit Basu. Who would like to get started?
Sure, start with Karen.
All right,
And please move the microphone closer to you. You can move it, you can pull it gently. Thank you.
Gently?
Yes.
All right. Thank you, Madam Chair, and Madam Vice Chair, and members of the committee. I am Karen Reardon with the Trade Association RISE.
Move this down a little. Yes.
We represent pesticide manufacturers that supply the markets that serve consumers and professionals, so those pesticides used in non-agricultural applications. Thank you for the opportunity to testify on HB 386. I wanted to share some important information with you about the risk assessment that undergirds all pesticides that are here in the market in Maryland and across the country. All aspects of pesticide distribution, sale, and use, as well as stringent safety standards and oversight, are established in federal law under the Federal Insecticide, Fungicide, and Rodenticide Act. And within Maryland state law, the Department of Agriculture has laws that it must adhere to as well with respect to how pesticides are provided and used here in the state. Both of those agencies have that responsibility for ensuring that products can be used safely and that products are available to manage pests and pathogens here in the state. Both have broad authority in current law to change the use status of any pesticide at any time. So I would urge you to think of that. If there were an issue that can be taken up by the Department of Agriculture, it can be taken up by US EPA at any time. To approve a new pesticide, EPA must determine through a rigorous risk assessment that when used accordance with the label, it will not cause unreasonable adverse effects to the environment and does provide a reasonable certainty of no harm to human health. An important part of EPA's product risk assessment is special consideration for sensitive subpopulations, children, the elderly, and the immune compromised. These tests take years to complete, and EPA must periodically reassess pesticides to ensure they meet these stringent standards. For these reasons, this existing risk assessment and regulatory process, we ask you for an unfavorable report on this bill.
Thank you, and thank you for excellent timing. Let's see if you can follow that, the next witness.
Good afternoon, Madam Chair, Vice Chair, and members of the committee. My name is Charles Barton. I'm a state-certified pesticide applicator representing the Maryland State Pest Control Association. We oppose the House Bill 386 because it severely limits our ability to protect Maryland residents from dangerous pest infestations and bypasses scientific processes used by the EPA to regulate PFAS. The EPA is already addressing PFAS. PFAS is a very serious public health issue, but banning thousands of products, including the products used in pest control treatments, is not the solution. The EPA is actively researching, restricting, and remediating harmful PFAS while preserving the beneficial uses. We encourage the legislator to follow the EPA's lead in regulating pesticide products to be used in public health infrastructure. The House Bill 386 eliminates essential pest control tools. The bill bans nearly all termiticide products, jeopardizing home sales, construction, and compliance with federal safety laws. The VA and FHA loans require termite inspections and treatments. We can't treat if buyers can't get loans. If we don't treat, buyers can't get loans. The public health is at risk. These products help to control disease, spreading pests like mosquitoes that can cause West Nile virus, malaria, Zika. It also helps to control bed bugs, cockroaches, which contaminate food and spread allergens. We already use integrated pest management to minimize pesticide use. This bill removes our last line of defense. In closing, the EPA, not the state legislator, should regulate PFAS based on science. House Bill 386 removes critical pest control tools, jeopardizing public health, food safety, and home protection. The professional pest control industry strongly opposes House Bill 386. Thank you, and I'm happy to answer any questions.
Excellent. Let's see if you could do that too.
Don't touch the mic. Don't touch the mic.
Sorry, I'll try.
It's okay.
Distinguished members of the committee, thank you for the opportunity to testify on HB 386. I'm Dr. Manojit Basu, the Vice President of Science and Regulatory Policy at CropLife America, a national trade association representing pesticide manufacturers here in the U.S. I'm also an adjunct professor at Johns Hopkins University teaching regulatory policy and other courses to graduate and undergraduate students. I hold a PhD in biological sciences and have conducted extensive research in academic, industry, and government settings. On behalf of CropLife America, we respectfully oppose this legislation. It is unnecessary given the existing robust federal regulation on pesticides and would disadvantage Maryland farmers by jeopardizing access to safe and effective tools for pest management. On definition, PFAS is an acronym that describes a large class of thousands of fluorinated chemical substances. Near applications of fluorinated chemistry have beneficial properties that increase their durability and resistance to heat, water, and oil, which can help improve products like cars, electronics, and medicine. In some EPA-approved pesticides, fluorinated chemistry can help improve adherence and provide better protection from pests. Significant regulatory attention has been given to studying PFAS, including the EPA putting in place an intra-agency work group to develop and implement a PFAS roadmap. As part of this work, EPA has taken a scientific approach and adopted a definition of PFAS that requires at least 2 carbon. This definition accounts for the important differences between different types of fluorinated chemistry and avoids grouping together all fluorinated chemistry in a way that is neither scientifically accurate nor appropriate. The definition suggested in HB 386 goes beyond the definition adopted by EPA and Maryland's neighboring state. This bill would lead to significant resistance problem due to limited modes of action. Agriculture is responsible for bringing over $8 billion in GDP to Maryland's economy each year. Thank you for the opportunity to provide our perspective on HB 386, and we urge you not to move forward with restricting Maryland's farmers' use of fluorinated pesticides.
Thank you for your testimony and for being here. Excellent timing again. Let's see what you can do.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Lindsay Thompson, and I'm here today on behalf of the Maryland Grain Producers Association, farmers who produce corn, wheat, barley, sorghum, and triticale in our state. We have confidence in the EPA risk assessment process that you have heard others talk about that has been in place under FIFRA for over 70 years through many, many administrations. As you've heard, EPA does use different definitions for PFAS for different classes of chemicals, and this bill has a definition that is inconsistent with both the Office of Pesticide Programs as well as the Toxic Substances Control Act. The OECD report that was cited by the proponents, while explaining some of the dangers of PFAS, also states in Chapter 3 that PFAS is a broad, general, nonspecific term which does not inform whether a compound is harmful or not, but only communicates that that compound shares the same trait of having a fully fluorinated methyl or methylene carbon. While there may be some alternatives to the pesticides that would be banned by this legislation, all pesticides are not labeled for all uses. Just because we're taking away over 1,000 doesn't mean that there are equal and opposite alternatives in the 13,000. For example, this bill would remove nearly 50% of the available pre-emergent herbicides that are labeled for soybeans. Not all products work in all landscapes, and therefore by removing these tools from the toolbox, we are jeopardizing the potential for integrated pest management as well as resistance management. One concern I have is that a pesticide that is not registered in the state may not be used in the state. And so if we are saying they can't be registered in 2027, without an existing stocks order, the ban would effectively take place in 2027. Not all PFAS are created equal, and we don't want to see our farmers disadvantaged by the utilization of this broad definition with the robust federal framework in place. Thank you.
Welcome. Next, please.
Madam Chair, Madam Vice Chair, members of the committee, for the record, my name is Tyler Huff. I am the Director of Government Relations for Maryland Farm Bureau. While environmental safety is a priority for farmers, banning an entire class of pesticides without viable alternatives threatens agriculture productivity. Many of these pesticides are integral in managing pests that could devastate crops, and their removal would place an undue burden on farmers struggling to maintain yields in an already volatile agriculture economy. One of the foundational principles of effective pest management is the ability to rotate pesticides with different modes of action. This practice is essential in preventing weed and insect resistance, which has become increasingly challenging in modern agriculture. With fewer pesticide options available, farmers will be forced to rely more heavily on a limited set of alternatives, accelerating resistance and ultimately reducing the effectiveness of all pest control measures. This bill fails to account for the unintended consequence of increasing resistance and reducing the long-term viability of crop protection strategies. While there are valid concerns about potential risks of PFAS exposure in non-agriculture settings such as schools and healthcare facilities, lumping agriculture use into the same category ignores the critical differences in application, exposure levels, and risk mitigation strategies used in farming. Many of the pesticides targeted in this bill play a crucial role in integrated pest management strategies. Without them, farmers will be left without effective means to combat invasive weeds, fungi, and insects that threaten crop yields. This could lead to increased reliance on mechanical and cultural control methods, which may not be as effective, sustainable, or feasible for all operations. If certain pesticides are phased out, it is imperative that farmers have access to equally effective and affordable alternatives. And with that, Maryland Farm Bureau respectively urges an unfavorable report, and happy to answer any questions. Thank you.
Thank you very much for your testimony and for keeping it
within the 2 minutes. I appreciate it. I have a sty in my left eye, so if I close my eyes now and then, it's because my left eye is hurting a little. That being said, I see Delegate Hutchinson, followed by, all right, your second question. Delegate Wortman, go ahead, Delegate Hutchinson.
Thank you, Madam Chair. So today I brought my Smart Book, and my Smart Book here says the definition of PFAS in here is about half of a page long in terms of how the state defines PFAS. I was actually quite surprised that that's what it was. And then I look at the EPA definition and I see 1 carbon, 2 carbon, different PFOA, PFOS. Tell me the difference, Dr. Basu, or did it, the difference between like our definition, which seems to be fairly benign, to a much broader EPA definition. And anyway, go ahead and answer the question.
Thank you, member. So the definition is broad, and it's trying to capture all the 15,000, 16,000 different chemistries. PFAS, the long chain, anywhere 8 carbon, 6 or 8 carbon and higher are the long chain PFAS. Anywhere between 6 carbon and lower have been known as short chain PFAS. There have been new terms that have coming up in multiple publication, which are ultra short chain PFAS, I've also heard. So yes, when you go and explore for definition, you'll see it all over the place. It is trying to capture everything that is fluorinated and has a carbon. What EPA did as it started looking at the definition is said, okay, what are some of the concerns we have seen with PFAS? What are the different structures that we need to look into for a PFAS? And finally, the EPA rule that we have now in place was a 2-carbon fluorinated compound, either partially or fully fluorinated. That's the definition. However, a lot of these definitions that we hear about in the States are all pointing back to the OECD definition. And as we heard from Lindsay, even in the OECD definition, they have said that different regulatory purposes will have to look at the PFAS chemistry within that respect and define how do they want to look into PFAS. The question here is it that we are going after just a definition, or is it that we are going after some concern? From a pesticide point of view, if the concern is human health and environmental toxicity, from the pesticide point of view, pesticides have to submit a lot of human health studies and environmental fate studies for any chemistry which is fluorinated. Now, these are fluorinated compounds getting pulled into a bigger definition of PFAS. I'll give you a simple example. Hydrocarbons is a big class of chemistry. The gas we put in our car is also hydrocarbon. A beer someone may enjoy is also a hydrocarbon. But I could call both of them under hydrocarbons.
Just to follow up, and so I keep hearing PFAS, so it's this broad category that's out there, and that's why I keep going back to the EPA definition and back to the efforts that Delegate Ruth is trying to get. If we were to use that definition, could we be systematically attacking the ones that really are bad, that we know are bad, and start eliminating those within our environment?
If we go with a federally accepted definition, we are specifically looking into the PFAS where there are concerns, and we are developing a strategy to get better understanding of all the PFASs that are in use today. Now, all the toxicologists and chemists will say that the impact of a chemistry depends on each one of them has their individual profile. The toxicity will vary. Just because it is a fluorinated compound doesn't mean that it will have the exact same toxicity profile and all of them are going to be bad. Now, what EPA's definition did is, okay, we understand the science for those 1 carbon. We are not concerned about 1 carbon. EPA registered pesticides with those 1 carbon definition, even in the previous administration when they came up with this definition and said they are not concerned because of this and this and this reason. What have we heard on PFAS? Persistence, bioaccumulation, toxicity, these are the kind of concerns we have heard. EPA has said these 1 carbon PFAS pesticides that they have registered, evaluated, they don't see those concerns at all. Some of the 2-carbon pesticides, they have said, okay, are PFAS, but we will need to look into it. So that's what EPA is doing. Once you are having the 2-carbon, you then have the ability to see what data is available. Again, the pesticides have the most data available from a human health and environmental toxicity perspective.
Thank you, Madam Chair.
My pleasure. Well, even my tired eyes can see all these lights. Wow. All right. It was warming.
Well, thank you so much for being here, and I really do wish that I had as much faith as you guys seem to have in the EPA. Right now, we've seen that the current administration has already signed executive orders rolling back a lot of the PFAS protections and the drinking water limits. Why should Maryland put any faith in that EPA is going to continue protecting Marylanders from toxic substances? Thank you.
The best, not the best person, but whoever has the best answer can go ahead.
That's the best answer. Mono, do you have the best answer?
I will answer. Thank you for the question. I genuinely appreciate it, and I briefly touched on it in my testimony. So pesticides are regulated under the Federal Fungicide, Insecticide, Rodenticide Act, FIFRA. Yeah. And so FIFRA was originally signed into law by Congress in 1947. And has been persistent through many, many administrations, including the first Trump administration, and was updated as recently as 2020. And so we do have confidence in the federal regulatory framework for pesticides that will continue to be protective through this administration as well. Additionally, the pesticide registrants actually contribute through PREA, the Program for Pesticide Regulation. They contribute funding to EPA as the regulated community, and because they understand that in order to utilize pesticides, they must be registered and they must have that license to operate. And so the industry has a vested interest, and the farmers and the agricultural community has a vested interest in ensuring that FIFRA moves forward so that we continue to have access to these products and we know that they can be used safely.
Okay, thank you so much for your answer. I'm new to the committee, so it helps to have all those pieces put together for me. Thank you.
Delegate Chisholm.
Madam Chair.
You're welcome.
It's very tough to put all this together. And when you started with a sty in your eye, I thought we were going to be entertained by some sort of Dr. Seuss limerick, but.
No, if you see me close my eyes, it's like, it hurts when it's first comes
Yeah.
out. So I don't want you to think about pulling my sleeves.
Thank you. Being that this is my 7th year on this committee, I know that we've had a PFAS bill in front of us every single time. And I remember when I first joined the committee, we had farmers just lined up back there on a couple of the bills. And I'm just curious because I think there was one farmer on the, that was in favor of the bill, but I haven't seen any as far as the testimony for wanting to testify in opposition to this bill. Is there any reason for that?
Sure. Thank you for the question. So I will say, actually, I am a farmer. Okay. So I am also a farmer. My husband and I farm grain in Queenstown. So when we have had similar bills that have been active ingredient specific, several years ago, we had several farmers come in to testify in opposition to a bill that would ban one specific pesticide. And as a result of that, some of the proponents of this legislation, including Friends of the Earth and Maryland Pesticide Network, put out an international call to action to contact those farmers. And one of them was a Montgomery County agritourism business that actually had to shut down their business for several days because they received over 10,000 calls and emails. So I can assure you that our farmers and our members are very opposed to this legislation, but we are protecting them and their businesses and their families by not bringing them into this forum.
Thank you. I appreciate that.
All right, let's go to Delegate Bandari.
Thank you, Madam Chair. Considering the environmental and health concern associated with PFAS containing pesticides, as you heard, and we did the research in various studies, not only the committee heard today. have your organizations, thank you for representing the farmers, either Maryland Grain Producers or Maryland Farm Bureau or CropLife America, explore or endorsed alternative pest control methods that do not rely on PFAS compound. For instance, integrated pest management, IPM strategies, and use of biopesticides have been identified as effective and environmentally friendly approaches that other states are looking. And what are your perspective on adopting such alternative to mitigate potential risk while maintaining the effective pest control? Because you know that the movement is there. Sooner or later it is coming. Are you guys putting enough resources to that route as well?
Thank you for the question, member. As far as for the Maryland State Pest Control Association and our viewpoint, integrated pest management is several things. It's education, educating our clients about what they can do to help to reduce the pest activity in their homes. Sometimes it's cultural changes that need to happen. Sometimes we can do exclusion, or we can do something, changing just the outer environment of the property to try to maybe have water run away from the home in a different direction, or perhaps we could to seal some holes or gaps, to prevent pests from entering the property. So we try to use pesticides as the last possible resort. It's not the first choice. We can use a lot of non-chemical monitors. We can use snap traps. There's lots of other mechanical methods that we can use for pest control. But when it comes to actually using materials, it's because problems escalate, and we need to protect our clients. We need to protect from foodborne illnesses in restaurants and in grocery stores. We need to have those tools, and we need to be able to rotate through a variety of products so that we can prevent insect resistance and the different rodent resistances to the products that we're using. If we can't use these materials that have some of these PFAS in them, we won't be able to kill termites that are eating up your home. The top 3 termiticides that are on this list have the active ingredients that are on this banned list. And those materials, we would no longer be able to use the top 3 choices that we would use primarily for termite control. I hope that answers your question.
We can talk offline. Thank you.
Delegate Hill, followed by Delegate Collison.
Thank you very much, Madam Chair, and thank you all for being here. And with 2 of you who I spoke a little bit before the meeting, I appreciate that too. You all came in as an opposition, but I thought what I heard was if there were a better definition, and maybe if there were a longer phase-out period, and then I'm going to throw this in, and maybe if there are actually products for which there is no alternative or affordable alternative that could be excluded, that you might be okay with this. So if we weren't talking about 1 carbon, Doctor, would you be okay with that?
That would be aligning with the federal definition.
Okay, and if you got to identify products that for which there is no real alternative, would that make you and your constituents feel a little bit better?
We would feel better if the definition was clearer, because we believe that the broader definition is banning too many materials that we find intricately important.
Okay, and Tyler, if there were phase-in over a longer period of time, would that help if all these other things were there too?
Yes, that would be beneficial.
Okay, so it sounds more like favor with mega amendments as opposed to opposition.
So I will say all 3 of the things that you just discussed were actually discussed with the proponents of this bill going into this hearing. The Committee of Compromise, we were asked to compromise. We went forward with compromises on definition, an essential use waiver, as well as the implementation date, and we're told no.
Okay, all right, thank you.
Delegate Hill, would you like to volunteer? It seems like you were doing quite well there. I think I'm going to volunteer you to work with a sponsor and to work with a panel and see, what can be done. All right? We can at least try. We don't lose anything by trying.
I'd be happy to co-chair that.
Oh, I will love that. I love this. Thank you very much. I like it. All right. So the primary sponsor, Delegate Ruth, if you can meet with Delegate Hutchinson, Delegate Hill, and the unfavorable for now, and see what we can do, okay? Let's continue with the questions. We have Delegate Taveras, followed by Delegate Collison.
Thank you. I just need a little bit of leeway on this one. Just quick questions. You mentioned that FIFRA was passed in 1947, correct?
Yes, ma'am.
Okay. Since when have PFAS been active and known to be harmful by DuPont and 3M?
I don't have an answer to your question.
That's since the 1950s. When were they discovered to be harmful?
I don't have an answer to your question.
Since the 1990s. When are they still adding chemicals to toxic release inventory, to TSCA, and to FIFRA from this, for PFAS?
Member, TSCA and FIFRA are two separate statutes. FIFRA only looks into pesticides that are approved for use in the U.S., and FIFRA requires a lot of studies, up to 150, which definitely is not one of the requirements in TSCA. TSCA has a different set of requirements than what FIFRA has. Very different statute, very different way of regulating and approving pesticides or chemical in general.
No, but I understand that, but we do have the Worker Protection Act and those kinds of issues that are relevant, and we have worked together with these other statutes, because I know I used to be an employee for EPA. With that, as of 2025, we've been adding chemicals. We just added 9 of PFAS to some of these lists. I just want to say that the molecular structure of these chemicals are similar. They're biosimilar. So the impact and the side effects of these in the body are similar. So I just want to caution us to make it seem like, oh, we're just trying to find what works. The issue is the molecular structure of these chemicals and the bioaccumulation in our bodies. It's really difficult to eliminate. So I'll leave it there. Thank you.
Okay. Do you want to give any feedback? You don't have to, just that, all right, don't worry about it. Thought I would give you an opportunity.
No, thank you.
Delegate Collison, followed by Delegate Johnson.
So chemistry was the hardest subject for me, and I did not go past high school chemistry. So this is, a lot of this is just going over my head.
I'm not going to tell you what I did.
Right. But I want to make sure that I understand, around the definition. And I think what I'm hearing you say is the one carbon definition is too broad and you need something more narrow. But other states have passed restrictions on PFAS. What definitions have most states used in their restrictions?
Well, so, excuse me, we have about 22 other states have passed laws impacting manufactured goods that contain per- and polyfluoroalkyl substances based on the one fully fluorinated carbon definition. Those laws do not include pesticides. We have 2 states that have included pesticides expressly. Within the other population of states, we have those that expressly, for example, California chose to exclude pesticides because they're rigorously regulated. As in Maryland, they have an entire state agency dedicated to the assessment and review of those products. So we have, yes, 20-plus states that have the one carbon definition. Only 2 of those states' laws actually took up pesticides within them, and that was because those were written as kind of a dragnet for all manufactured products.
May I follow up quickly? Sure. Do you have a sense of the impact in those 2 states that have included pesticides?
Well,
Or is it
as
too
has
soon?
been noted, the band dates are out in 2032, so further out.
Okay.
But we do see there will be thousands of products impacted. I'll say in one state, this could be relevant for all manufactured goods. Maine amended its law and came back in 2024 and excluded products that were manufactured in Maine in key industries, except agriculture. So they have economic drivers in the state, the aeronautics industry, et cetera. Legislators learned they wouldn't have cars under the ban as it was written. So they made certain exclusions. So I think that does speak to what are we looking for with respect to the definition? Are we looking for something that has meaning from a regulatory and public health and safety protection standpoint? Or are we simply looking at a lot of stuff that it's hard to get our arms around, whether or not there's harm or not?
Great. Thank you very much for the information.
Delegate Johnson?
Madam Chair, and thanks for
pleasure.
coming to answer some of our questions. You used the EPA to kind of make us feel at ease and give us some comfort. But hasn't the EPA lost several lawsuits having to do with pesticides? One of them from Center for Food Safety for not testing pesticides, even though federally mandated.
I'm not sure, Mono, do you? I do not have familiarity with that, and I would think to know that. Several petitions have been filed with EPA in this matter by non-governmental organizations. Several of those have been rejected by EPA on scientific and regulatory grounds. I cannot speak directly to that.
Okay, they've also made many settlements with organizations over pesticides. But thank you for trying to answer. Thank you, Madam Chair.
Any other questions? Delegate Bagno?
Thank you, Madam Chair. And I apologize that I didn't think to ask this of the other panel, but I know that we have 2 states that have had broad-scale bans, 22 other states that use this definition. There are other states that are currently have current legislation in to consider this. Do you know if there are any other states that use this definition that are looking at similar legislation to what's being proposed in Maryland?
Actually, we have 2 states right now that are, we're aware, and this is pending legislation, so I'm not making a definitive statement. But
that's why I had the caveat.
In legislative committees in 2 states, we have consideration of a 2-carbon structural definition, deferring to EPA structures. We have one state right now considering excluding federally FIFRA-regulated products. We had another that is considering a PFAS bill that would exclude pesticides, given their regulation. We have 2 neighboring states to Maryland, Delaware, and West Virginia that have passed a 2-carbon definition into law with respect to certain water quality activities within those states. So it's a mixed bag.
Thank you. And just as a follow-up, so just to follow up on that, so other states are taking their own action ahead of the EPA because they're not necessarily following the EPA guidance. Is that correct?
I'm not sure that I would characterize it that way. But I will tell you, states do have to meet requirements under the Safe Drinking Water Act and other federal statutes that require them to take action legislatively in some of these matters. Their regulatory agencies have to have that. They can't do it, their compliance activities by rule. So there are some other drivers to this.
Thank you very much. Thank you, Madam Chair.
Yeah. Any other questions? Okay. We have actually a lot more people, and we're going to go to another panel. But before you leave, I do want to say thank you for being patient as we ask these questions. And those of you that are waiting still to, testify, we're listening. You can see that the questions are very thoughtful. And that is the committee. It's funny that you said this is the committee of compromise. We try very hard to be intentional about that. And in that light, I would like for you to make yourself available and see what you can work out with the subcommittee being led by Hutchinson and Hill. And anyone else that would like to join it can join it as well, okay? Thank you so much.
Thank you.
And you can feel free to use my conference room, all right? So let's go to another panel of favorable. Let's go with Bonnie Raindrop, Emily Ranson, and Steve McDaniels. Will you be so kind and come up? And go ahead and have a seat, and as soon as you sit down, will you be so kind and start your testimony? Good afternoon.
Good afternoon.
Will you be so kind and move the microphone closer to you?
Yes.
And you can get started. Tell us your name.
Thank
And
you.
you'll have 2 minutes to provide your testimony.
Hi, my name is Bonnie Raindrop, and I'm the coordinator of the Smart on Pesticides Coalition of 112 organizations and businesses. And last year, I testified from my bed in front of this committee.
I remember.
Thank you very much for that. I was awaiting surgery for ovarian cancer. My only conditions were high cholesterol and thyroid disease prior to the diagnosis. No family history, no genetic predisposition. My risk factor was exposure to the everyday toxics we all come in contact with. I had my blood tested for PFAS. I scored as having potential for adverse health effects. And the 3 health conditions I mentioned are all associated with PFAS exposure. I can't say what caused my cancer, but a decade of study about the harm from toxic pesticides is clear. Pesticides, including PFAS pesticides, are everywhere. And as you know, cancer is epidemic. This cancer took my reproductive organs, my colon, spleen, part of my stomach, and was scraped off my diaphragm and abdomen. It damaged my urinary tract, requiring a surgical procedure every 6 months for the rest of my life. It'll most likely kill me, but I'm working very hard to postpone that as long as I can. But here's my point. We're poisoning ourselves, and this bill will eliminate an avoidable source of PFAS. And I'd like to switch gears for a second and address this issue of definition. The scientific definition is the definition of one carbon atom. And if you look at EPA, they have not changed that definition. The Office of Water and the Offices of Research and Development, which have been studying and regulating PFAS for more than a decade, are all still using that definition. But EPA does allow individual departments to use a definition that narrows the scope of it to associate with a certain body of work or project. And this definition is being used as if it's the global definition for EPA, and it is not. Also, Congress, Department of Defense, everyone else is using the scientific definition, and it would be very damaging for us to change that definition away from what science supports. Thank you so much. We hope for a favorable report.
And thank you for being here. How are you feeling?
Much better. I'm currently in a remission, and I hope that I can
that's
make it
wonderful.
last.
Praise God.
Thank you.
Good. I'm so glad you're with us, okay? And thank you for taking time out of your precious life to be here, okay?
I'm very
Appreciate
pleased to be here. Thank you for having me.
You're welcome. Next, please.
Good afternoon, members of the committee. I am Emily Ranson with Clean Water Action, here in support of House Bill 386. PFAS poses a significant threat to our waterways. This is not an abstract concern. PFAS has been found in Carroll, Howard, Hartford, Washington, and Wacomico County bodies of water and drinking water sources. Methods for removing PFAS in water is expensive, and the cost will be borne by the state, municipalities, and people who did not put the PFAS there. PFAS is a...
Will you be so kind and mute yourself? Steve McDaniel?
Okay.
Sorry about that, it happens.
No worries. Okay, so PFAS is a forever chemical. It extends through the food chain. So we need to turn off the tap on PFAS contamination by eliminating it in our pesticides where it is sprayed in close proximity to people, on our food, and throughout the environment. I also worked on some of the previous PFAS legislation that this body has passed, And Maryland's PFAS definition was carefully crafted, and creating a new definition could have unintended consequences. We have significant concerns about the TSCA definition. It's problematic, it's not scientific, and it is not used by other regulatory bodies in the world. We are concerned that changing the definition would open up new loopholes, and manufacturers would be incentivized to slightly tweak their chemical compounds to something that is just not yet included in the definition. So thank you, and we urge a favorable report in keeping the definition.
Let's go to Steve McDaniel, and then we will open it up for questions. Steve McDaniels, please. Is he there? He's in the waiting room? Okay. Yes, good afternoon, sir. How are you? And will you be so kind and give us your testimony?
Yes.
Thank you.
Yes, my name is Steve McDaniel. I'm a certified master beekeeper, one of about 150 in the United States, past president of the Maryland State Beekeepers Association. I also have a degree in chemistry from Harvard, so if you'd like a little simplified explanation of the chemistry, I'd be happy to entertain a question about that later on. HB 386 will protect the health of our bees. As you already know, our food supply depends heavily on pollinators. PFAS pesticides are highly toxic to bees, all of them, thereby impacting the health of our food supply. Our bees are having a difficult time surviving in an environment that is saturated with poisonous chemicals, and PFAS are among the worst. Reports coming in as recently as last week, even yesterday, from major commercial beekeepers pollinating almonds in California tell of high losses from 50 to 100%, wiping out some major operations and reducing the potential almond crop significantly. Losses of bees are being called sudden, nationwide, and severe, similar to the colony collapse disorder we experienced in 2006. In 2024, USDA put out a survey of 49% losses. I would love to have only a 49% loss of my bees. Mine last year was 19 out of 20, 95%, despite my best efforts to keep them alive. Those losses are financially devastating to beekeepers. A study on the effects of PFAS on bees found at a microscopically low concentration, PFAS halts all brood rearing in the colony. Killing the babies kills the colony as the bees only live about 6 weeks. You constantly have to have new ones. The colony is doomed without that. At slightly higher concentrations, the colony may not last a day. So they're very, very toxic to bees. We must stop impacting the future of our food supply by eradicating our pollinators. This is simple common sense to protect people's and bees' health. Please vote for HB 386.
Thank you very much for being with us. We really appreciate it.
You're
I'm sorry about your bees.
It breaks my heart. I feel like somebody's poisoned my dog when I go out and find a beehive dead.
Yeah, yeah, and it's very sad, right? What we're doing to the earth.
It really is, and it's everywhere. PFAS
Yeah.
isn't the only problem, but it's one of them.
Yeah. Let me open it up for questions. Are there any questions for these three witnesses? Seeing none, I just want to thank all three of you for being patient as we ask the questions and for being with us. For those of you that are still waiting, hang in there. We're going to get to you. And we really appreciate your patience. Since those were three favorable, I want to be balanced, and I want to go to the unfavorable. I have, one second, I have Nina. Actually, they're all virtual. There's 1, 2, 3, 4, 5. So if I may have Nina Daco. Okay, so let's hold on to her. Let's do Logan Freeman, who's unfavorable. Terrence Stovall, who's unfavorable. Amanda Hagan, unfavorable. And Michelle Copa, unfavorable. Let's do those four just to be balanced. Will you please bring them up? Thank you so much. And to the committee, we're almost there. Mr. Freeman, will you be so kind, good afternoon, and welcome to the Health and Government Operations Committee. Will you be so kind and please give us your testimony? And then we'll go to Mr. Stovall and then Mr. Robin Todd. I think that's what it says.
Thank you, Madam Chair and Madam Vice Chair and committee members. My name is Logan Freeman, and I'm a golf course superintendent in Harford County and the Vice President of the Maryland Turfgrass Council. And I'm here today on behalf of the membership of 1,300 plus individuals tasked with managing much of the turf grass in the state of Maryland via golf, sports turf, sod production, lawn, and landscape. The turfgrass industry provides major economic benefits, countless recreational opportunities, green space, as well as extensive environmental benefits, including carbon sequestration, filtering of pollutants, reduced surface runoff, erosion control, noise reduction, and beneficial cooling effects, especially in urban settings. I'd like to mention 3 active ingredient examples that would be removed from our industry based on the legislation. Dithapir and prodiamine are pre-emergent herbicides that provide extended, flexible, and effective control of major troublesome weeds, including crabgrass. Without key pre-emergent herbicides like these, repeated applications of post-emergent herbicides would likely be needed to achieve season-long control. The insecticide Novalorin is a relative newcomer to the golf market and is on this list. It has allowed me personally as a golf course superintendent to reduce my insecticide applications by 50%. This is an example of how loss of proven active ingredients can have unintended consequences. Consequences like increases in applications needed to control pests, resistance issues, decreases in turf quality that can adversely affect safety and overall conditions for recreation and sport. Loss of key active ingredients can cause increases in operational costs, reduced revenues, and detrimental environmental impacts from the loss of the many benefits quality turf provides the state. For these reasons, the Maryland Turfgrass Council respectfully requests this committee give this bill an unfavorable report. Thank you for the time. It's very much appreciated.
Thank you for being here. Mr. Stovall, will you be next, please? Good afternoon.
Good afternoon. Afternoon, Madam Chair, Vice Chair, and other distinguished committee members. My name is Terrence Stovall. I'm delivering comments on behalf of the National Association of Landscape Professionals. We are the national trade organization representing the landscape industry, and we employ tens of thousands of employees in the state of Maryland. Our member companies specialize in lawn care, landscape maintenance, tree care, irrigation, as well as water management. Our members are trained, state-certified landscape and lawn care professionals who work daily performing essential services to homes and businesses to maintain their landscapes, sustain the environment, and enhance and maintain healthy and safe green spaces. Among many other tools, access to chemicals such as bifenthrin and prodiamine are essential to landscape and lawn care professionals who maintain green spaces in communities across the state of Maryland. When used according to label directions and as part of integrated pest management programs, these products are effective in controlling invasive plant and insect species. Additionally, restricting and banning the use and registration of these products does not account for the void that will be created by their loss, which could force our members to use alternatives that could be lower in efficacy and result in increased costs for landscapers and in turn, the customers that they provide these essential services to. EPA, in concert with state lead agencies, conducts regular reviews of all products and active ingredients to ensure their efficacy and safety before and after they are approved for use in the field. And we believe the determinations related to the review of ingredients and products should be left in the hands of professionals at the regulatory level as intended in the Federal Insecticide, Fungicide, and Rodenticide Act. For these reasons, the National Association of Landscape Professionals respectfully requests an unfavorable report on House Bill 386. Appreciate your time and your consideration.
With us. Let's go next to Mr. Robin Todd. I believe it is. That's what it says on the. I have for the virtual witnesses, Amanda Hagan, not here. No. How about Michelle Copa? Can you go ahead, please?
Yes, good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Michelle Lopez Copa,
And I am here on behalf of the Household and Commercial Products Association to express our opposition to House Bill 386, as it takes an overbroad approach to regulating PFAS and pesticides and could lead to unintended consequences. HCPA is a business association representing manufacturers of household cleaning, disinfectant, and consumer pesticides. These products undergo rigorous scientific review by the US EPA and the Maryland Department of Agriculture before registration. Further, registered products also undergo periodic reviews to ensure that they continue to meet the latest safety standards. HB 386 could set a precedent of bypassing these established processes, potentially resulting in unnecessary product bans. It is critical to recognize that not all PFAS are the same. The broad classification of NHB 386 fails to distinguish between different PFAS categories, uses, and risk profiles, which could result in bans of safe and effective products. We urge the committee to prioritize science-based regulations and avoid policies that could undermine existing regulatory frameworks. For this reason, we respectfully request an unfavorable report for House Bill 386. Thank you very much for the opportunity to provide comments.
Thank you for being here. Mr. Robin Todd, you are favorable, so you're going to have to wait for the next panel. These are unfavorable panelists. If I may, I believe it's Ms. Amanda Hagan. You are unfavorable,
Yes.
and you can get started.
Great. Thank you so much, Madam Chair.
You're welcome.
Co-chair, members of the committee. I appreciate that you will have read my letter, so I'll be brief. My name is Mandy Hagan, and I am Director of State Affairs for the Animal Health Institute. AHI, as you know, is the trade association for the makers of animal health products, the medicines that help our animals live longer, healthier lives. One of the reasons that we get to enjoy the close proximity of living with our pets is the availability of parasiticides, which obviously are pesticides, and use fluorinated chemistries as active ingredients. These products have been thoroughly tested, regulated by FDA. And I wanted to add a couple of comments about the other states that have been brought up. In Maine, when they amended their statute last year, they made a complete exemption for animal health products, as well as some other things. So they've gone and revised some of their broad language that they had in the bill initially. And I think Minnesota is probably worth taking a closer look at as well, just in terms of how they deal with pesticides specifically, because they make specific provisions for, in the 2032 broad ban, there needs to be a review by the Department of Agriculture for pesticide bans, as well as they have separate provisions for banning additional chemicals by rule. Pesticides are specifically not to be banned by rule. So they do have different regulation in their PFAS statute for pesticides specifically. So wanted to point that out, but that's all I have, and I'm happy to answer questions. Thanks.
I want to say thank you for being here, and I know it's late and you've been waiting, so thank you so much. You have a blessed afternoon, all right? We are going to go over now, I believe that was the last unfavorables that I have, and we're going to go now back to favorable, and we have Mr. Robin Todd. Is he still on there? Yes. Can you let him give his testimony? Cleo Braber. And Kevin Wengernock and Jason Davison. Will you bring them up, please?
Honey, it's not working.
And is there a Steve McDaniels? Yes. Will you bring him up as well? So you should have Steve McDaniels, Kevin Wengernock, Jason Davison, Cleo Braber, and Dr. Robin Todd. And I believe that that's the end of all these witnesses, but I'll ask when we're done. All right, so Mr. Todd, since you were here first, good afternoon, everyone. You get 2 minutes to provide your testimony, and then we'll open it up for questions. While the person is speaking, will you be so kind and mute yourself? If you could mute yourself, that would be wonderful. I see 3 people are muted, and I need 2 to mute themselves. Mr. Todd, please get started. Ms. Braber, please mute yourself. Thank you. 1 second. Cleo Braber, will you please mute yourself? Thank you. Go ahead, Mr. Todd. You can get started. Thank you so much.
Hello, Chair Benya Melnick and members of the committee. Thanks for sticking in so long. My name is Robin Todd. I'm a retired board-certified entomologist, and I spent 7 years in Grand Cayman working at the Mosquito Research and Control Unit before coming up to Baltimore in 1979 and spending the next 36 years testing and registering insect control products for our chemical industry clients. I then spent 3 years consulting for similar clients. I'm strongly in favor of HB 386 owing to the harmful effects of PFAS pesticides. I took it upon myself to have my own blood tested recently and learned that I have a somewhat concerning level of just under 10 nanograms per milliliter of total PFAS. Now, one of the main complaints I've heard against 386 is that it would limit the number of pesticide products to Maryland's farmers, landscapers, pest control operators, and homeowners. But this ignores the fact that there are 14,000 products already available, as has been alluded to by Delegate Ruth and others earlier. If the bill passes, a mere little bit less than 8% of these would be taken off the market, leaving fully 13,000 products to choose from. My written testimony gives links to the top 10 PFAS pesticide from 2022 MDA records showing all the alternative products for each pest that these top 10 PFAS pesticides are labeled for. So I see very, very little impact from the bill, if it's passed, on the availability of effective pest control products. And I thank you for your time.
Appreciated. What about, why don't we go to Mr. Davidson?
Thank you so much, members of the committee. Thank you for having me. I'm Jason Davidson, a senior food and agriculture campaigner with Friends of the Earth, the National Environmental Advocacy Organization. And I advocate for pesticide restrictions at both the state and the federal level. And so I'm concerned by the opposition's continued call for Maryland to follow the EPA. As many of you probably know, the future of EPA's regulatory programs are massively uncertain. The only logical explanation that I can surmise is that this testimony was written before Inauguration Day. As the way the federal agencies are going, the entirety of the offsite pesticide programs and other regulatory programs could be cut entirely, their funding frozen. I've heard also mention of the periodic reviews that EPA does to regulate pesticides. These happen every 15 years. They're often delayed and end up going longer. And each time they do a regulatory review, it is predominantly based on industry submitted studies. And they fail to take into account the broader scientific body of evidence. And EPA has always failed the environment and public health under FIFRA, and Maryland has stepped up repeatedly to resolve that. Maryland restricted neonics under President Obama. Maryland banned chlorpyrifos during the Trump to President Biden transition. And frankly, EPA's roadmap on PFAS and pesticides under President Biden was insufficient to begin with, and as you've heard, already scrapped and unlikely to continue and move forward. Maryland has played an important role as one of just a few states stepping up to be stricter than EPA on many of these pesticides of concern. And certainly we would encourage Maryland to do the same, and we urge a favorable report of HB 386. Thank you.
Thank you. Ms. Braber.
Good morning. Good afternoon. My name is Cleo Braver. I'm the co-owner with my husband of Cottingham Farm in Easton in Talbot County. You've already heard from Steve Krzyzewski on the sponsor panel, one of Maryland's largest organic grain growers. Steve and I represent here today 170 Maryland farmers who have signed on to our joint written testimony from farmers all around the state who grow all the crops that are grown in Maryland. And we grow them without using PFAS pesticides, grain, vegetables, fruits, meats, poultry, et cetera, both conventionally and organically on farms from a few acres to just almost 1,000 acres, from first-gen farmers like me to fifth-gen farmers like the Mason family, Steve and his family. You know, what's transpiring in other states is really nothing short of catastrophic. It's a nightmare for farmers that are impacted by PFAS contamination of their farms. More than 70 farms in Maine alone have been so contaminated they have been put out of business. It has cost the state of Maine more than $60 million to help to even buy out farms that have tested at unsafe levels of PFAS. An insidious source that's contributing to this poison farmland, PFAS pesticides. We want Maryland to avoid this horrific outcome of our pesticide policies. HBA 386, we think, turns off the tap. It protects farmers, our food, our customers from further PFAS poisoning of irreplaceable resources like our farmland, soil, and waterways. These pesticides contaminate farms both by direct application, but also by drift or runoff from neighboring farms. Without turning off the tap, these are all ongoing pathways of ever more intense contamination. And more intense contamination means that more varieties of crops cannot be grown in the soil. We don't think agriculture can continue to be Maryland's #1 industry if we poison the farmland on which we grow our food. We know there are hundreds of alternative inputs that can be used, and hundreds of us Maryland farmers use them in order to avoid using PFAS pesticides. On behalf of all the farmers who signed on and those who didn't get a chance to, we urge a favorable report. Thank you.
Thank you. And thank you for, having your farm in Maryland, all of you, for caring. I believe I have one witness left, and it's Mr. Kevin Wengernuck. Good afternoon, sir.
Oh, there we go. Can you hear me?
Yes, I can.
Okay.
Thank you.
My name is Kevin Wengernuck, and I am the founder and president of KW Landscaping. We've been in business now for 32 years, and we've been organic for 16 years. For over a decade, I have been trusted to take care of the Maryland State House grounds, and we have done that organically. And it is with my experience and commitment to sustainable land care that I think I provide this testimony to support HB 386. For the past 16 years, the commitment to organic land care, we have demonstrated that with effective cultural practices while using organic and natural products, our results are impactful and the chemical alternatives are not needed for success, especially the PFAS. While there are 22 of these pesticides registered in Maryland, which are labeled for lawns, we use none of them to keep the State House and our clients' lawns healthy, beautiful, and with little weed pressure. We know that there is simply no need for using these pesticides. Our efforts at the State House lawn were originally a pilot project based on the then Maryland Governor's Bay Cabinet and with the assistance of the Maryland Pesticide Education Network. We wanted to prove that an all-organic approach could create a healthy lawn despite heavy foot traffic. Our State House there in Annapolis is one of only 2 state houses in the entire country that is completely has a chemically free lawn. We support HB 386 because it aligns with our core belief that we must take care of the earth, the creatures that share it, and the health of our communities. We would appreciate your support of HB 386.
And Mr. McDaniel, you testify already. Am I right? I do remember.
Yes, I did.
With the bees, yes.
Yes.
Wonderful. So I'm going to open it up for questions now from the committee. Are there any questions for this panel? Delegate Taveras.
No, thank you, Madam Chair, and thank you for coming out, or being at least virtual to, and advocating for this important issue. To Mr., I want to say Weinhardt, the gentleman that keeps our lawns so beautiful here in the, Weingernut.
That's it. There you go. Congratulations. You win a prize.
Well, thank you. So yes, so thank you for your commitment to healthy lawn keeping. Does it cost you more to do what you do, and does it require you to hire more staff what's the cost differential between using PFAS and
I will
not?
say that currently, some of the products do cost more than conventional products. But a lot of what we do is, like I mentioned, cultural practices, and that's like efforts of like aerating and overseeding. We do a lot of soil testing, which is actually required by the state of Maryland for treating lawns. And based on those soil tests, we do a lot of specific enhancement to the nutrients that are deficient in the soil. Our goal with the organic approach is basically to create a healthy soil, where I want to say the chemical approach, which is, I'll use the word conventional, all they're doing is feeding the grass and making it grow. Where we're trying to create a healthy living soil that then the grass can then feed off of that. We also do that in our landscapes. So it's basically just to go back in the process of what Mother Earth has created and intends to happen.
So how are you able to root out invasive species and weeds, et cetera?
So, I mean, there definitely are organic herbicides and fertilizers that do prevent weeds. I mean, and they're definitely in use. So, I mean, there are some parallels to the conventional and an organic program, but I also will say this, like certain weeds will grow in certain environments and they thrive in an unhealthy soil. So if we can create a healthy soil, it's going to be less weed pressure. And I will also say this, no lawn, whether it's conventionally treated or organically treated, is going to be weed free. You're always going to have issues. And I have seen plenty of chemically treated raw lawns that have just as much weeds as, when we start taking over an organic lawn, if that makes sense.
Yes, thank you.
Any other questions? Seeing none, I want to thank you for being patient and for being with us. And I hope you have a wonderful, blessed evening, okay? Is there anyone in the audience that did not get called? Did I miss anyone? I don't think so, but just checking. All right. This actually concludes the bill hearing on House Bill 386. Excuse me? Who's in the waiting room?
Oh, the favorable with amendment.
Oh, the favorable with amendment. Okay, well, 1 second, please. We do have one favorable with amendment. All right, let's bring the person in. Yes, good afternoon. Yes, you can get started. How are you? Can you hear me? Yes, can you?
One second, please.
Okay.
I'm
Okay.
trying to watch the, I'm watching this online as well. Good afternoon. Can you all hear me?
Yes.
All right, great. Thank you. All right, so my name is Nina Dacko, and I'm here on behalf of the American Mosquito Control Association. And I must say that filing a letter and also deciding how to exactly come into this was a little confusing because it's favorable with amendments, but I would really kind of call it unfavorable unless amended. And so I'd like to start by saying that. So the American Mosquito Control Association represents mosquito control professionals, private, public, and academic. Most of our members are those that will actually serve on behalf of a local government, for example, either a public health department. And so we are in the interest of public health mosquito control. And we always refer to EPA. And so I heard a lot of people talk about definitions. We do, since we refer to the label instructions, we refer to EPA's definition of PFAS as well. And I heard a lot of folks talking about this. And so we go hand in hand with that. Also, we agree with a lot of the sentiment that a lot of folks who oppose this bill would say. However, I would say that we don't want PFAS being treated in the environment as well. But we want to make sure that the definition is consistent with EPA to avoid confusion. Additionally, though there's 14,000 chemicals out there, there are very few for mosquito control. There are only dozens. And so we need to maintain some of these, we need to maintain all of our tools if we can. And a few of these are in the interest of Aedes aegypti and albopictus control. So there's a lot of different species of mosquitoes. Some of them will carry something like dengue, chikungunya, Zika. And those are actually targeted by a few of these particular chemistries that we don't want to lose, namely bifenthrin and lambda-cyhalothrin. So we really do not want to lose these chemistries. Thank you.
Okay. You're welcome. Are there any questions for this witness? All right. So thank you for being with us. We appreciate it. So that you know, and the people watching, we have favorable for those that support the bill. Favorable with amendment, meaning that you didn't support it, but if it was amended, you will support it. And unfavorable, meaning that some people, no matter what you do, will never support the bill. So those are the three categories, and that is the reason why. In any event, if you testify in the future and you need any more explanation, my team is amazing. Please feel free to give us a call. Thank you for being with us today. We really appreciate you, and you have a blessed day. Thank you for being patient. You were our last witness, but we listened. So thank you very much. For those of you that are in the audience, thank you for being with us. Those of you that are home, we appreciate you watching and being involved in this whole process. And for the committee, thank you for paying attention, and I hope you get to rest. It's been a long day. Have a blessed evening. And for our team, thank you for the work you do. For the trooper, thank you for being with us.